Good evening. In East Africa, it's an evening. In East Africa, it's an evening. It's exactly 40 minutes past 5 or 20 minutes past 5, and we are going to start our live right now. So it's Ask Dr. UTHUMAN live, and you can ask any question of your choice. I'll be there to answer you. We are live on Facebook, on YouTube, and TikTok. So in just 2 minutes, we are going to start right away. So please prepare your questions. Prepare your questions. Today I'm not going to teach. I'm not having any topic today. It's you to ask questions and then I answer. It's a Q&A today. So just ask any question. I'll be able to answer you. So we start right away with questions on YouTube. And I told you, those guys on YouTube, if you'd like to become a member of Ask Dr. UTHUMAN, please you join, become our member, and when you become our member, you'll be having a chance to have a one-on-one chat with me. So register, become a member on YouTube, and get benefits, a lot of perks. So let's start right away with questions on YouTube. We have someone is saying the symbol embarrassing. All right, we have Juliet Kakoza. Hello doctor, would like if CDA 20 tablet for treating fibroids. What are you trying to mean? Please write your question clearly. I don't understand Kakoza. Let me understand your question clearly. So let's go straight forward to questions. Please ask any question of your choice. I will be able to answer you. But mainly we answer questions regarding reproductive health. That is to say, questions regarding women health. That's the area I understand most. So ask any question. I will be right there to answer you. So this one is saying, how many days do we test for pregnancy with a strip? All right. This is Suma Halim. How many days do we test for pregnancy using a strip? Now, if you look at that HCG strip, that HCG strip is supposed to be, it starts testing you, it starts getting, if you conceive, when fertilization occurs, that test strip, because first of all, there are two test strips. We have the blood and urine. Kesper, there are, now, a little bit down, I'm straining to put my eyes up for you to let it be down. No, I'm straining. That okay? Okay, all right. So the number of days for an HCG strip, we have two strips. That's what I was saying. We have the blood and then the urine. If you look at the urine, it takes longer, but blood is so fast. So if you're using a urine strip, pregnancy strip, it will start testing positive from 10 days to 14 days. We usually say it's 14 days to be sure. So if you suspect to have conceived, test after 10 to 14 days. If you test at 10 days and you're positive, that's okay. But if you don't find yourself positive at 10 days, then wait until you reach around 14 days. That's when you'll be sure that you are positive. That is when you are doing an HCG strip, urine, using urine. But if you're testing using blood, blood is so sensitive. Some people can test for pregnancy at 5 days. 5 to 7 days, you can already see your results, and if you conceived, you can see positive results. So at 7 days, up to 7 days, that is if you're using blood or serum, and at 10 to 14 days if you are using a urine strip. Another question. This one is saying, good evening from Russia. Someone is in Russia. Nick Diamonds, you're in Russia. Say hi to the Russians. I hope you're not under those missiles. Say hi to, he's called who? The president of Russia. Putin. President Putin. Say hi to him. This one is saying, hello doc. Jedida Kinori is saying, hi doc, can I conceive a baby boy without orgasm and in ovulation day? Yes. You people, who told told you that you need to first have orgasm before you conceive. Conception, you don't need orgasm. As long as a man has orgasm for a man is important, but orgasm for a woman is not important as far as fertilization and conceiving is concerned. So what you need to do is to make sure that the man has reached orgasm. The man has released. As long as the man has released the sperms, as long as the man has ejaculated, then you won't have any problem with conception if it is on your ovulation day. So that's okay. There is no problem about that. He's saying conceiving a baby boy. Of course, when you have sex on the ovulation day, you have very high chances of conceiving a baby boy. But what we are meaning, sex on ovulation day, that means that you didn't have sex in the other days. Because someone will tell you, I had sex on my ovulation day but ended up conceiving a baby girl. That is not the issue. Because you'll find that this person had sex on the 10th day, had sex on the 12th day, had sex on the 11th day, and again sex on the ovulation day. So that means that person has high chances of conceiving a baby girl. So it is, as long as you abstained in these first days, then you're good to go. This one is Diana Moses. I'm Diana from Kenya. How can I find you and your hospital? Diana from Kenya. Say hi to the Kenyans. But our hospital is located in Uganda, in Masaka City. It's called Bikoff Medical Center. And if for a private conversation, book your appointment via my website, www.druthman.com. And I guess you're seeing the website is passing down there. The words passing down there, they are showing you our website. Let me have some questions from TikTok. This one is saying, okay, now Julie, good evening, doctor. Good evening. How can you give birth to a baby boy? Giving birth to a baby boy. Now, I told you the other time that if you want to target a baby boy, number one, if you want to conceive a baby boy, have sex on the ovulation day. Sex on the ovulation day, you get high chances of conceiving a baby boy. And also, I released a video about those very many ways someone can use to conceive a baby. But the most accurate one is having sex on the ovulation day. But having sex on the ovulation day, it means that you've abstained from having sex on the other days, the other fertile days. So you have sex on only the ovulation day, then you'll be having higher chances of conceiving a baby boy. So another question, this one is saying, Namaya and Januliyat, Dr. Nzembuza lwaki bwe mmala periods zange ne wayitawo weeks 2 nziramu ne mmumwa olubuto nga nvaamu amazzi n'olusaayisayi siri mu family planning. So this one is asking why she gets abdominal pains and some discharges after 2 weeks of having periods. Now, 2 weeks after having periods, that is likely to be your ovulation day, because even if a woman, during ovulation, a woman will have or may have lower abdominal pain, may have discharges, may have such symptoms. So check properly if that is not your ovulation day. And if it's not your ovulation day, then probably have some infections that need to be treated. Lighting on YouTube, is it okay? See some darkness. Then we have Treasure Ogokuchu saying hello. Then this one saying, hi doc, can I conceive a baby boy without orgasm and on ovulation day? I said that one, I talked about it. I said yes. Hello doctor, why do I have too much cramps and dark clots of blood, which wasn't the case? Yeah, sometimes you may be having some PIDs, some infections. When you have PIDs, pelvic inflammatory diseases, you may have such things. Hormonal fluctuation can cause that. You're saying you never had that. Yes, it is possible that you never had this while you are still growing, but now in adulthood you're developing these symptoms. That comes as a result of age and hormonal fluctuations, then plus also exposure to various infections. Another question, Colette Annie, doctor, I don't usually see the egg white discharge. Does it mean that I am not ovulating? Now, not seeing the egg white discharge does not mean that you're not ovulating. There are some people who will not show the signs of ovulation. There are some people who will not show that they're having signs of ovulation. So, and also, by the way, it is not only the discharge that is a sign of ovulation. There are other signs, like we've talked about, some lower abdominal pain, some, because during ovulation someone feels like they want to have sex, that increased libido. Actually, the day someone is ovulating, they really feel like they want to have sex. And now this is a trick to boys out there. If you've been dating someone and has not been accepting your proposal, make sure that you target this person on the ovulation day. When you target this person on the ovulation day, there are very few chances that she will refuse. There are very few chances that a woman will not accept on the ovulation day, because on that day they really feel they want to have sex. They really feel horny. They feel like they want everything to be done. So therefore, if you target this lady on the ovulation day, just know that the chances of her accepting are very high. We have someone requesting to go live on TikTok. So we have another question. This one is saying, Doctor, hello, Midway is saying, hello, Doctor, hello to you. Doctor, please, after taking Chromid, I noticed breast discharge, and it's something to worry about. Is it something to worry about? Breast discharge, because now we are going to tackle two things. Number one, someone is requesting to go live on TikTok.
Oh, yeah.
Accept them. So,
Facebook, should I
disconnect?
Yes, I did.
It's okay. It's okay. We leave Facebook.
I did.
And there are questions.
All right. Let's have those questions before you disconnect. So now,
On Facebook.
okay, I am being disturbed by people on Facebook. There is a problem with our Facebook, but let me first answer these people on Facebook, and then I come to you guys on YouTube and TikTok. I'm coming. But let's answer these questions, and most of them may even be also important to all of us. This one is saying, how can my break, Doctor, how can my break after ovulation? Really, I don't, but to me say, Abdion, I don't understand this question. Someone help me understand what this question is all about. He's saying, Doctor, how can my break after ovulation? I don't get the question. Someone let me know what this person is missing. Is talking about. AI Kiyime saying, Doctor, mfuka omusulunga gwa yellow, could there be a problem? This one is saying that is urinating yellow urine. Is there a problem? Yes, there could be a problem. When your urine is too yellow, is purely yellow, then you're likely to be having dehydration, that you have less water in your body. And therefore the solution is to take plenty of water. If you have yellow, deep yellow urine, that is, it's likely that you have dehydration. Number two, it's also likely that you have a UTI, a urinary tract infection. People with UTIs tend to have a deep yellow discharge. Then another thing is having a lot of sugars in your body, probably diabetes and so on. But the most important ones are these two: infections and dehydration are the major causes of yellow urine. And also some drugs, some medicines we take can also cause urine. This one is saying, Justin Navidio is saying, Doctor, my one fallopian tube has hydrosalpinx, but the other one is okay. Will I be able to conceive? Justin Navidio, tomorrow at exactly 8 p.m., that is 20 hours, invite these people, at exactly 8 p.m., that is 20 hours East African time, watch my live. Watch my video. I'm going to post a video concerning conceiving, how someone can conceive, how someone can get pregnant with only one fallopian tube. Tomorrow at 8 p.m., go to my YouTube, ask Dr. UTHUMAN, check out that video. It will be live at exactly 8 p.m. or 20 hours East African time. Hold on the wound. It avoids accidental touches. Okay. So I think those are the questions on Facebook. So let me continue with this question on YouTube. This one is saying, Doctor, I don't usually see egg white. I answered that. Doctor, please, after taking Clomid, I noticed breast discharge and it's something to worry. Now, this is what I wanted to talk about. After taking Clomid, you noticed a white discharges from your breast. Is it something to worry about? Yes, it is something to worry about. Because in the first place, let's ask ourselves, why were you taking Clomid? Why were you taking Clomid? Probably you're likely to be having an issue. You're likely to be having an issue with hormonal imbalance. Probably you have hormonal imbalance. That's me. You have an issue with hormonal imbalance. So if you have hormonal imbalance, you're likely to also be having high levels of prolactin. That's why I say that before you take Clomid, first do tests. Now for you, maybe you took Clomid without doing a fertility hormonal assay. Because with Clomid, if you did, that one is this slide. Trophy. That one is this slide. So you maybe you have high levels of prolactin, and if you have high levels of prolactin, you are likely to have breast discharges. So it is not Clomid that brings about the discharges. Breast discharge is not one of the side effects of clomiphene. It is not one of the side effects of clomiphene, but high levels of prolactin can cause that. Therefore, maybe you had high levels of prolactin, and that's why you're having that problem. We have another question. Is saying, hi. Another person is saying, "Hi, doctor. I missed my period for a year now. I am 37 years old lady. What could be the problem? I am watching from South Africa. Gracious Thaurai Gracious from South Africa is been having amenorrhea, that is loss of periods, for a full year, and wants to know what the problem could be." There are many causes of amenorrhea. But the most important one is usually hormonal imbalance, and that is when, and that condition is called hypoprogesteronemia. You have low levels of progesterone in blood. When you have low levels of progesterone in blood, then you are likely to have amenorrhea. Another cause can be some people with fibroids, but also someone who is using hormonal methods of family planning, like an implant. Women who are using implants are likely to have amenorrhea, to have loss of periods. Another one could be Depo-Provera or hormonal pills, family planning pills. Those ones can cause that. Thanks for answering my question, Jedida. Okay, I'm humbled. Thank you. Temia Christine is saying, "Hi, doctor. Hi, everyone here. My question is it possible to treat fibroids with only tablets?" No. Fibroids are treated using two methods. Number one, the surgery, cutting them out, either doing open surgery. If you are faced with a fibroid, just know that we have the following measures we can do. Number one, opening your abdomen. When we open your abdomen, we enter into your pelvis. When we enter your pelvis, we open and see the uterus. When we get the uterus, we can now look for where this fibroid is, whether it's outside or it's inside. When it is inside, we can also still cut through the fibroid. After cutting through the uterus, and then we scoop out that fibroid in a process called myomectomy. In a process called a procedure, that procedure is called myomectomy. So if we do myomectomy, we can remove the fibroid. Number two, if someone does not want to do surgery or use to do laparoscopy, that person can use injections. And the injections which can be used, we have leuprolide Glupride and goserelin. So we don't have, tablets are not effective. Yes, we have some tablets, of course, they can give progesterone medicines and so on, but they are not so effective for shrinking the fibroid. So we mainly use injections and the operation. So we have another question. This one is saying, hi doctor, I have a child of 2 years old, but I am trying to conceive, but nothing happened. But my period cycle is changing every 26, 29, 32 days. What can I do to conceive again? Now, thank you so much. You're called invisible. Someone is called invisible here. The person asking questions is called invisible. Now, Mr. All, this is a miss. Miss Invisible. This is what you are going to do. Number one, go and do tests. Which tests? I want you to first go and carry out what they call a pelvic ultrasound scan. What is that scan going to show you if you want to conceive and you're failing to conceive and you want to know what the problem is? Go and do a pelvic ultrasound scan. This scan is going to find out whether you have fibroids or not. This scan is going to find out whether you have a retroverted uterus or not. What's that? No. It is going to find out whether you have a retroverted fibroid or not. It is also going to find out whether you have any abnormality, any mass within your uterus. Now, when you're done with a pelvic ultrasound scan and you're sure that everything is okay, go on and do a fertility hormonal assay. Wait. Hold on, Caroline. Hold on. First mute. I'm going to invite you. First mute yourself, Caroline. First mute yourself. I'm going to invite you. So, after doing a pelvic ultrasound scan, you are now going to do a fertility hormonal assay. You are going to do a fertility hormonal assay. A fertility hormonal assay is going to assess all your hormones to find out whether they are in normal ranges or not. Then after doing that, you do an HSG X-ray. With those tests, you will be sure what the problem could be, and then a solution can be found. Caroline, increase the volume. Caroline, let me have your question. Your live.
Yes, doctor.
Yes, what's the problem? How are you?
I'm okay. How are you?
Be a little bit louder. I want everyone to hear what you're saying.
I'm okay. How are you, doctor?
I'm okay.
Yes, doctor. For me, I have a question. Yeah.
Yes, go on with your question.
I'm in long-distance relationship.
You are in a long-distance relationship, yes?
Yes, but my person, whenever is around, it's like I'm not in my days of conceiving.
Yes.
So I wanted to try Clomid to help me, like fertility stuff that can help me, because we wanted this time around we are preparing and like my fertile days, but I thought of having like an assistant of those tablets. Is it okay, like Clomid?
Now, Caroline. You see, first of all, what you need to learn is to learn. Caroline, now you can mute. We need less noise here. You can mute. Let me answer you. All right. So, what you are supposed to do, what you need is not clomiphene. What you need is not clomiphene. What you need is to understand when your ovulation, when your fertile days are. And how are you going to do it? I want you to study your menstrual cycle. So whoever is in a long distance relationship and wants to target ovulation, you are in a long distance relationship, you're staying far away from your spouse, you meet once in a while. and you want to conceive, what you're supposed to do is to first study your cycle. First study your cycle, understand the length of your menstrual cycle. After understanding the length of your menstrual cycle, calculate, find out your ovulation day. When you find out your ovulation day, invite or go to your spouse on the day you are ovulating. There you'll be able to conceive. Don't get worried about the distance. My husband is far away. My husband is in Lebanon. My husband is in USA. We meet once. We meet in the summer. It is possible for you to conceive by targeting your ovulation day. So now let me give you an example. Caroline, do you know how to calculate the length of your menstrual cycle in the first place?
Yes, I do know.
You know.
I know.
So if you know how to calculate, so what is the length of your menstrual cycle? Let me get for you the ovulation day. What is the length of your menstrual cycle?
It's 32 days.
32 days. So now if you have a 32 days, this is the length of your menstrual cycle. It is 32 days. What you are going to do, if you have 32 days, you are going to do this.
Yes.
Get 32 minus 18. What's the answer? I'm not going to give it to you.
It's like...
This is for everyone out there who has a 32-day cycle and you want to conceive you want to meet your spouse and conceive on that day. So let's look. You have 32 days. 32 minus 18. I want to give you the answer. Let me have answers. Someone on TikTok. This question is from TikTok. Let me have those on TikTok to give you the answer. It's 14. Okay. So you have 14. That means this is 14. So 14 plus 4. What do you get? So 14 plus 4, what do you get? Caroline, I'm with you. I want you to first understand. I always want someone to understand, learn everything. So 14 plus 4.
18.
18. So that means 18 is your ovulation day. 18 is your ovulation day. So target to meet your husband on this day and see if you will not conceive. You'll be able to conceive, you'll be able to get pregnant on this day. If the length of your menstrual cycle, people asking, if the length of your menstrual cycle is 32 days, then target having sex with your husband on the 18th day, you'll conceive. How do you how do you get to know that this is my 18th day? When you see your periods, you see the problem with some of you start calculating after menstruation. The moment blood stops that is the time you start counting. But we start counting on the day you see your periods. The moment you see your periods, kata, day 1, this is 1. So count 1, 2, 3, 4 on the 18th day. Have sex on that day. I am sure you will conceive if there is no any problem. Are we together, Caroline?
Yes.
All right. Is there any other question, or we say bye-bye to you?
Bye-bye.
All right. Next time, where are you?
I'm in meeting.
All right. Nice time.
Thank you.
All right. So let's have this one, Muna. Now, first pause. Let me first get to the people asking questions. Those ones writing. I will invite you, Caroline. You can take yourself away. Then we remain with Muna. Then we shall come to Muna in a bit. Let me first answer these questions on YouTube. So we're having someone is saying, Nalika Justins, where can I find you if I need a scan? I'm 5 months pregnant. All right, find me in Masaka. Big of Medical Center in Masaka. It's this clinic is within town. It's in Masaka town, opposite Club Ambias. That's where we are located. Then another one, Justin Nabilio is saying, my right tube was diagnosed with hydrosalpinx, but the left one is okay. Will I be able to conceive naturally? Thanks so much. Justin, I am inviting you tomorrow. Tomorrow at 8 p.m., all 20 hours East African time on my YouTube, I am going to release a video about that question. It is specifically tackling your question. So be live tomorrow at exactly 8 p.m. I release that video, you'll get the answer. And everyone who is watching, go to YouTube at 8 p.m. 20 hours East African time. Go there, you'll find out whether it's possible for someone to get pregnant with one fallopian tube. Okringi Moses is saying, hi doc, my wife went for family planning method and she got Cyanopress for 3 times. That was in 2022. But up to now, she hasn't gotten her periods back. What could be the problem? The problem is Cyanopress. The problem is Cyanopress. Cyanopress is like Depo-Provera. It has high levels of progesterone. This progesterone will interfere with the progesterone in the body. And it will cause amenorrhea. It can cause amenorrhea because Cyanopress has levonorgestrel, Depo-Provera, all those ones, they have a hormone which is similar to Depo-Provera. And therefore they will cause that. So, what is causing the problem is Cyanopress. Cyanopress is a family planning method which is given to women. It's like a patch. It's put here anywhere, and that is a side effect of that family planning method. This one is saying, Machitilda Brenda is saying, can, well, you don't get a question. Machitilda Brenda is saying, hi doctor, can late ovulation result into late periods? Yes. Yes. Now you see someone, what you're calling late ovulation, that means the length of your menstrual cycle. You have a come and decline this call. Come and decline this call. Decline that call. Decline the call. Okay, so what you are calling delayed ovulation is actually not delayed ovulation. What you're calling delayed ovulation is not delayed ovulation, but what you're calling, it's because you have a longer length of, the length of your menstrual cycle is long. When the length of your menstrual cycle is long, you will have, your ovulation day will also come at a later period. So that is not a problem. Miss Machetilda Brenda. Let's have Muna. Muna, ask your question on, please go on and ask your question live.
Hello.
Yes, please.
Yes, please. My question goes.
Be very loud, your name, and be very loud with your question.
Okay, I've been married for 3 years now. I've had 3 miscarriages.
You married for 3 years and you've had 3 miscarriages.
Yes, I've had 3 miscarriages, yes.
Okay.
The last one was in last year, and since last year I've not been able to conceive.
Okay.
Now the issue is, what last year when I had the miscarriage in August, it was a 2 months pregnancy that I lost. I went to the hospital. I had a DNC removed, and it was removed there. After the cleaning, for 3 months I did not get my menses back. So I went back to the hospital. I was made to do some tests. I did an estrogen test, which I was told is very high, and that because of that I had gone into menopause.
You did, are you talking about progesterone or estrogen? The test you did. Estrogen, progesterone? Estrogen.
Estrogen.
And it was high?
It was very high.
Okay. High levels of
Yes.
estrogen, yes.
The doctor just told me I had gone on menopause like that.
Yes.
And that I could not conceive again unless IVF.
You went for IVF?
My menses are returned. Now I get my menses every month. But still, when I go to the hospital, that's the same thing the doctor tells me.
Muna, where are you?
Yes. I'm in Ghana.
You're in Ghana. All right.
Yes.
You said, so when you went and did estrogen test, you only did one hormonal test, that is estrogen.
Yes.
Allow me to say that you are not serious, Muna. With such a condition, you are supposed to do a full hormonal profile. Do a full fertility hormonal profile. Okay? Go and do estrogen. Go and do progesterone. Let you know the levels of your luteinizing hormone. Let you know the levels of your follicle stimulating hormone and prolactin. Okay? When you have those ones, you can now find out the medicines to take. And by the way, that miscarriage that happened, you are likely to be having low levels of progesterone. Why? Because when you have high levels of estrogen, there is that negative feedback which will cause the depression or the lowering of the progesterone level. Okay? This part. Nisi Lato, please mute yourself. I'm still with Mona. Please, that second person on live, mute yourself. Let's first conclude with this one. All right, thank you. So that means when estrogen is high, it will lower the levels of progesterone. And when the levels of progesterone are lowered, the things you can get, you can have early miscarriages as a result of hypoprogesterolemia. And that's why you find some women, they conceive and they are given dufastone medicines. You find someone is on dufastone. You find someone is on microlute injections. It's because they have low levels of progesterone in blood altogether. So what you're supposed to do is to run a full fertility hormonal assay. Next week on the same time, Thursday same time, I'm going to be live. Go and do those fertility hormonal, do a fertility hormonal assay. Come back with those results. Then we discuss again and find a solution for you.
Okay, thank you
All
very
right,
much.
thank you so much. Say hi to those Ghanaians out there and share our life so that they can also get the information we are giving. So we shouldn't be selfish. You tell everyone, let everyone get health information for free. All right, so you can get off and for this lady's called Daisy Lasto, I'll come to you. Let me first get into these questions here. We are having Yomu Juf on YouTube. You're saying, hello doctor, what are the early signs of twins pregnancy? So you're suspecting to be pregnant. Yomu Juf, all right. Signs of early signs of twin pregnancy. Number one is we call it hyperemesis gravidarum. Hyperemesis gravidarum. Hyperemesis gravidarum is a condition whereby a pregnant woman is vomiting every time there is excessive vomiting. The vomiting is excessive. Yes, we know that when a woman is pregnant, they have a tendency of vomiting. Okay? They have a tendency of vomiting. But with pregnancy, with twin pregnancies, this tendency is extended. It is so frequent that every time a woman wants to vomit, that is, we call that condition hyperemesis gravidarum, and it is one of the few signs of twin pregnancy. Another one, we call it if the fundal height is greater than the weeks of amenorrhea. What do we mean by fundal height? I think for you can now call it, because fundal height may be too medical. For you can call it bump size. The bump size. You know, when a woman is pregnant, you get that bump. Okay, your tummy becomes big. So when your tummy gets big, and you look at your tummy, it's bigger than the size of your pregnancy. Maybe you are at around 20 weeks of amenorrhea and your tummy is just above 40 weeks of amenorrhea. Then you are likely to be having twin pregnancy. So I guess I've given you those signs and you can now find out what to do. Yes.
Facebook.
Completely
So, cutting, I don't know.
Facebook is off. It's okay.
Off one, off one.
It's okay, you leave them.
Should I go on?
No, you leave them.
I leave.
You just leave it. Those who will get, they will get.
No, as in the other time it was keeping series, a lot of clips. So should I go live again or I leave?
Go live. Alright, so then we have this one is saying, hi doctor, Mia Sirindoro is saying, hi doctor, where are you? I want to make an appointment. I'm in South Africa. Mia Sirindoro, you're in South Africa. I'm in Uganda, East Africa. That is Masaka. But for online consultation or online appointment, you go to www.druthman.com. I think you're seeing that passing down on your YouTube. You can book an appointment using that. Then we have Tukunda Daphne saying, good evening doctor, how can I know that I have blocked fallopian tubes? Because I have been trying to get pregnant for 3 years, but I have failed. There is no physical sign of blocked fallopian tubes. You cannot be there and then maybe get a sign, a feeling, and then they tell you it's that feeling or the sign you're having is because of blocked fallopian tubes. No. No. But what happens, like for example, if you take long without conceiving, you may end up doing tests, several tests to find out why you're not conceiving. And maybe an HSG X-ray can show you that you have blocked tubes. But clearly you won't see any sign, any visible sign. And whatever you find on internet, people saying there are these signs, when you see this, you know that you have blocked tubes and so on. Those ones are fake, and it is not clear that really you may not know that you have blocked tubes. Except for those people who have chronic PIDs, they have been having pelvic inflammatory diseases for so long, they can have those signs. You only have signs of PID, which can be a risk factor for you to have blocked tubes. Let me use that water. Okay, so let me answer some questions on TikTok. This one saying, please doctor, my prolactin is 544, very high, and I want to conceive. This is high. This is high. High levels of prolactin, 544 mils per liter is high, and therefore you need to take medicines to lower the levels of prolactin. And the medicine you can take, who is this one asking? Modo baby, the medicines you can take, you can think about medicines like berberine, you can think about medicines like bromocriptine, but I kindly ask you to go to the hospital, get tested, and get those medicines clearly. So we have some other questions here. Someone is saying, Tumwebaze Milia is saying, hi doctor, where can I find you? I said we are in Masaka, it's Bikoff Medical Center in Masaka City. Then we're saying Jedida and Amore is available on Mondays and Tuesday. That's the time Amore is available there. Then this one is saying Jedida Kinol is saying, hi again. Can I count my cycle with irregular days and I know my ovulation? E.g. 25-day cycle. When is my ovulation day for that month? Alright, so Jerida is saying the cycle is 25 days. Now, I am inviting everyone here. Is someone making noise here?
Tell them, you want TikTok.
Who is that? But he's not there.
They're there.
Take him off. Someone unmute yourself. I mean mute yourself. All right. The screen is not clear. The screen is not clear here. The screen here. So you're saying you have a 25-day cycle. So let's calculate for a 25-day cycle. Someone who has a 25-day cycle. 25 days. You see, I've taught this of a very long period of time, but I will not get tired because I know I get many new people every day. But those of you who are always following me, don't get tired when I start writing this. I said, no, doctor taught us that the other time. Again, he's teaching us the same thing. Don't get tired because we are getting new people every day and we have to serve everyone. This is a free consultation which is available for everyone. So now, if you said count with my regular day, I want ovulation. Okay, you want your ovulation day with a 25-day cycle. A person tell everyone, if you have a 25-day cycle, this is how your fertility can be calculated, the fertility days. We are saying 25 minus 18. Okay? Miss Jedida Kinoru. I don't know where you're coming from. Let me know the country you're in. Jedida Kinoru. If you have a 25-day cycle, say 25 minus 18, and the answer will be 7. So 7 is the beginning of your fertile days. 7 is the beginning of your fertile days. Therefore, you can start having sex on the 7th day of your menstrual cycle. 7th day of your menstrual cycle is the beginning of your fertile days. From the 7th day, you can conceive. Baby ma, first wait a little bit. Let me finish this explanation. I'm coming to you. On the 7th day, you can conceive. Now, get 7 plus 4. I want this calculation to be very common to everyone. Understand this. 7 plus 4, you have 11. 11 is your ovulation day. Miss Jedida Kinoru. 11 is your ovulation day. 11 is your ovulation day. Therefore, the 11th day, if you start having periods today, count 1, 2, 3, 4, 5, 6. On the 11th day, that is your ovulation. Then 11 plus 5, you get 16. What does it mean? From the 7th day to the 16th day, these are fertile days. Fertile days, 7th to 6th. Any other days, they are safe. You can have sex, you not conceive. Days in between here, you are fertile. On this 11th day, that is the ovulation, higher chances of conceiving. I think you've gotten me, Miss Jedida Kino. So let me have a question from Baby Ma. Baby Ma, how are you?
I'm okay, doctor.
What's your name and where are you? Where are you?
I'm called Maria. I'm the one in Uganda.
Mariam in Uganda. Uganda is big. I'm also in Uganda.
I'm the one of Budo.
You're in Budo. All right. So what's your question? What's the problem?
Doctor, problem here again of imaging center.
But I know you can speak English. I'm sure you can speak English. Please. I know you can. Try.
I went to imaging center. Then they gave me the results when I'm having synacia.
Yes, uterine synacia. Yes.
Yes.
Everyone listen to this. It is very, very important. Call everyone. Let us understand what uterine synacia is. It is one of the main causes of infertility. Yes, go on. They told you have synacia.
Yeah. Yes, that is it.
Alright, they told you. Now, if you have uterine synacia, it will be very hard for you to conceive. This is what uterine synacia is.
I don't conceive now, it's almost 3 years.
Definitely, you can't conceive. That will be a miracle. That will be a miracle for you to conceive if you have uterine synacia. This is what happens, colleagues.
I conceived once, then the pregnancy was not fertilized.
Yes. Now, I don't know if everyone is watching this clearly. This is our uterus. This is the cervix. This is the uterus. This is our cervix. And these are the fallopian tubes. What they mean, if you look at this cervix, this uterus, it is like this inside. A uterus is like this. You have this wall and this wall. When they unite like this, they form a uterus. In between, there is a hole. That's why we define a uterus as a whole organ. Inside, there is a hole like this. One lip, second lip, they form the uterus. Inside, there is a hole. What is the use of that hole? Is where the sperms pass. This hole is here. This one, this hole. It is where sperms pass to go and fertilize the egg. It is where the baby sits. After fertilization, it is where the baby grows from. With uterine synacia, it is when the walls of your uterus, the two walls are adhered to each other. This wall comes in contact with this one. This is what I mean. Uterine synacia. It is very, very common in some women. Remember, our uterus was this and this, forming that hole. Now with uterine synacia, the uterus is like this. This wall is adhered onto this wall. Now tell me how someone is going to conceive and keep the baby in the uterus. Impossible. Because the uterus cannot, the baby cannot be kept in such a place. You must have a holy structure for you to keep the baby inside. Now, a person, now baby man and everyone who is not conceiving and you have uterine insemination, what you are supposed to do is to go to the hospital, they do a dilatation and curettage. This is a simple operation, a simple procedure. We enter inside, we got the uterus. It is like this. If it is adhered, attached on, the walls are adhered onto each other, we go in and open and detach the two walls and create the hole again. That's how it's supposed to be treated. And when the hole is when the hole is made, when the adherence is broken, then you make a hole again, someone can conceive. So baby ma, get an operation done, let the walls of the uterus be separated, you will conceive. Without that, even if there is a chance of conceiving, the baby cannot grow within the womb. That baby will be aborted. You will get a miscarriage, or you will have what they call a blighted ovum, or a condition whereby you are pregnant, but there is no heart in the baby has no heart. That is what they call a blighted ovum, or what they call a misty abortion. Invite someone else.
Yes, that's what I got. Thank you, doctor.
Welcome and have a nice time. Say hi to those guys in PG.
All right.
Okay, so you can take away your, so you can hang up. Let's have someone else. This one is called Tumwebaze Media. Where can I find you? I've already said find me at Bikoff Medical Center in Masaka. Then another one saying Sarah Nakasiye. Hi doctor. Okay. Kadabara Juliet saying hi doctor. Hi doctor. I lost my 6-month pregnancy. When shall I have another child or pregnancy? Now, I said in the other live videos, and so I said that when you lose a pregnancy, or when you get a miscarriage or an abortion, wait for at least one menstrual cycle. Wait for at least one menstrual cycle and conceive again. There is no problem, you can conceive again, but after having at least one menstrual cycle. Secondly, I hope you've also found out what caused that miscarriage. It is very important to find out what caused the miscarriage before you conceive again. All right, who is this? Thokozire. Thokozire, yes. How are you? Where are you calling from? And what is your problem? Those on YouTube, just write your questions. I am seeing all of them, and I am going to answer every question on YouTube. I'm going to answer whoever calls on live on YouTube, on TikTok. So don't worry, everyone. I'm going to answer all your questions. Just keep there. Please, you've been invited on the live and you're not speaking. We are going to take you off. Theo Kozire, what's your problem? All right. So let's have another question. This one is saying, is Catherine Mwinga. Catherine Mwinga is saying, doctor, my legs have been swallowing. My legs have been swallowing. I went for checkups. I was told I am okay, but never checked for pregnancy. Can it be it? Your legs have been swallowing. I don't really understand this question. Please ask this question again. I'm not getting it. Questions on Facebook, let me have them. Then this one, Sarah Nakasirio, YouTube, you're saying, hi doctor, I have used the Clomid for almost 2 years, but I've failed to conceive. Hey, Nakasirie, have you been following my programs? Why were you using clomiphene? Because I said you only use clomiphene when it is necessary. First of all, is lack of clomiphene the problem, the reason as why you're not conceiving? Is lack of clomiphene. You mean you have hypochlorphinemia? Chlomiphenemia. You have low levels of clomiphene in your blood. That's why you're taking clomiphene to conceive. Clomiphene is not used like that. That I've failed to conceive and I'm taking clomiphene. You'll take even 100 tins of clomiphene. You'll not conceive. Solve the problem. You may be taking clomiphene when your problem is prolactin. You have high levels of prolactin. Plug in the charger. You may be taking clomiphene when the problem is prolactin. You have low levels of prolactin or high levels of prolactin. You may be taking clomiphene when your problem is actually progesterone. You may be taking clomiphene when your problem is that you have fibroids. So taking clomiphene won't give you any results. We take clomiphene if the levels of LH, FSH are low. That's when you take clomiphene. Or when you've tested and what you really need is to cause super ovulation or to stimulate ovulation. If the problem is ovulation, that's when you take clomiphene. I hope you get me right. Mildred is saying, hello doctor, watching from Zambia. Mildred is watching from Zambia, saying, can an cyst on the ovary stop lady from getting pregnant? Yes, an ovarian cyst can stop you from getting pregnant. Alright, so it can stop you from getting pregnant. Then this one is saying, thanks, I'm watching from Sudan. Alright, say hi to the South Sudanese, those tall guys. Say hi to them. Then we have Treasure. Treasure is saying, thanks doctor for answering my question. Thanks for answering my first question about clomid. I have actually conceived twice before without taking my fertility drug. Alright, that's good. Hope you've understood that, clomid. Thank you so much for understanding. You know, sometimes we explain and people fail to understand, so we will be thanking you. Yeah, the picture is now clear on YouTube now. We shall be thanking you for understanding. So this one is saying, doctor, is ovarian cyst treated permanently? How can it be managed? Ovarian cyst. Now, ovarian cyst, it can be treated. Yes. Yes, it can be treated. An ovarian cyst can be treated. I said that most of the ovarian cysts are infectious in nature. Most of them. And therefore we give antibiotics. I have always said that we give at least 3 types of antibiotics. The first one, we can give an antibiotic in a class of the cephalosporins, fluoroquinolones or quinolones and so on. Then we add a drug that can fight against chlamydia. Okay, we also add an anaerobe, and a drug which can fight against anaerobic bacteria, that is metronidaz and so on. So a cyst can be treated completely as long as it is not hemorrhagic. That is number 1. Number 2, as long as this cyst is below 5 centimeters, they can be treated medically. And if it's above 5 centimeters, then we go for an operation. Then another question here. Okay, let's first see this one on Facebook. Is saying Demondea Christabel is saying, doctor, what is adenomyosis and the treatment? All right, adenomyosis. This is also a very important question. Thank you so much, guys, on Facebook. These guys are so active, yet our internet is disturbing them on Facebook.
Good evening, doctor.
Good evening to you. First, hold on. Let me first answer someone on Facebook here. Just mute yourself.
I have been looking for you.
First,
I'm following you for.
First mute yourself. I'm going to answer you. First mute.
Okay.
Let's first answer this one. Mute yourself. You're causing some noise. I'm going to talk to you. Let's first answer this person.
Okay, no problem.
So we want to know what adenomyosis is. Adenomyosis. Adenomyosis. Adeno. I now have many students here, medical students and some doctors who are learning. So I write this word for you. Adenomyosis. Dr. Odere, you're there. Dr. Fisher, so all those ones. And many other medical students. Some medical students sent me messages here. Medical students from Makerere University, medical students from South Africa, is it called Pretoria, and medical students from Alexandria University in Egypt. So this is yours. You should understand this. Adenomyosis. There is someone also from Alexandria University in Egypt. You asked this question. I think you also, so you should understand this. What adenomyosis is. Now, this is the uterus. This is the uterus. It was already here. Why did I remove it? This is our uterus. I told you that the uterus has 3 layers. Okay? It has this outermost layer. You can call it the ectouterus or perimetrium. We have this inner layer, which is called we have this innermost layer. This one is called the endometrium, and this is myometrium. This one is myometrium. This one is endometrium, and this is perimetrium. I don't know if I'm disturbing my people who are not medics here, but let me explain this very well. A uterus has 3 layers. The outer layer, now for you, even if you don't say perimetrium, call it an outer layer. This is for my doctors and medical students. This is the perimetrium. And then this is myometrium, the layer which is in the middle, call it the middle layer, and then the innermost layer. Now, this endometrium is the one responsible for menstruation. It is the one that does it sheds off for you to see blood. For you to see blood, this one will shed off. Now, people with adenomyosis, you will find that this endometrium has grown into the myometrium. That's why it's called adenomyosis. The endometrium has grown into the myometrium. Am I confusing people? I am meaning that this layer, which is supposed to be innermost, has made itself to grow in the middle of the uterus. And that is what we call adenomyosis. Miss Demonda Christabel, students of Alexandria and Pretoria, you asked this question. So, adenomyosis is a condition whereby this layer is growing from inside the uterus. That is in the middle layer. You end up with adenomyosis. And with this condition, of course, it will be also very hard for you to conceive. I guess you've understood that. If you haven't, you can still send out your question and I rectify what is not clear. All right, so Miss Dija Buba, hello, how are you? Where are you calling from? Where are you and what's your problem? Hey, you've gone off? All right. Let me have Adeba, Miss Adeba, unmute yourself and ask the question. All right, let's have someone else. This one is saying, hi doc, it's called Eve W1993. He's saying, hi doc, I am Evelyn from Kenya. I am struggling from irregular period and delayed fertility. My period comes after 4 months. Oh, sorry. Having periods after 4 months. And before it flows, I become so sick. I have low concentration when it's cold. Now, let's answer this one of periods after 4 months. You are likely to be having a problem with your progesterone. Check the levels of your progesterone. They are likely to be low. Check if you don't have fibroids. Check, and or again, if you've not been taking family planning, I hope you've not been taking family planning like injector plan or an implant. If you've been taking any of those ones, you have to wait a little bit longer for the drugs to get out of the body. But amenorrhea is likely to be caused by hormonal problems with your hormones or the structural problem or having fibroids and any other masses there. There's a question, Madobel is saying, Doctor, please, what is the meaning of lactate I need to get that word clearly. I need to get that word clearly. All right. They will make it clear. I'll see. So let me get another question. That's not clear. Okay, let me have another question. Thank you so much, doctor, for answering my question. God bless you. All right. Doctor, my result for FSH is 7. My doctor prescribed for me metformin, letrozole, folic acid for a year now. I am a woman in early 40s. Is that the only medication for? You see, you are giving me results without giving me reference ranges. You are giving me results without giving me reference ranges. Now, I may not know which, because most of these equipment used to test, to do those tests, have different reference ranges. So I need to know the reference ranges to understand whether that was normal or abnormal. To some cases, it will be normal. Others, it will be abnormal. All right, now here we get the question. It will be abnormal, so we need to understand that. So first, give me the reference ranges to understand that. So let me pass through other questions. All right, so this one is saying, doctor, please, what is the meaning of lactate dehydrogenase? Hey, all right, lactate dehydrogenase, it is an enzyme. It is an enzyme in the body. It is found in most of the body parts. That is lactate dehydrogenase. It is found in most of the body parts. It increases the levels of LDH. I don't know, this one is likely to be a medical student. You know, when medical students start asking me, I confuse my other audience because we start speaking those words that these people will not understand very well. But it is an enzyme. It is found in almost all body parts, but more concentrated in the liver and other areas. It increases LDH, the levels of LDH. I don't know if you've gotten what you wanted. And it is also responsible for the heart attacks, anemias, and so on. I don't know specifically what you wanted to understand in that question. Let me have, okay. Hi doctor, can you help me? Because they told me I have uterine synesthesia. Uterine synesthesia, we've talked about uterine synesthesia. We've discussed about uterine synesthesia. Can clomiphene make you pregnant with twins? Yes. Yes. When you take clomiphene in the right dosage, in the right way, you have high chances of conceiving twins. And most of those twins are usually fraternal twins. Yes. Then let me have some other questions on our YouTube. Temia Christine, thank you, Doctor. All right. If I asked questions, doctor, I ovulate almost every month for at least 1 week. Will I be able to get pregnant in my 30s? Of course, people ovulate once in a month. So I don't know. Yes, if you ovulate once in a month and it is normal. It is normal to ovulate once in a month and you will conceive if there is no any problem. This one is saying, Namfuka Afiswa, me, I know how to calculate the length of my menstrual cycle. Thank you so much. Thank you so much. If you know how to count the length of your menstrual cycle, that is very, very fine. Then someone else is saying, Oleuru wa Agibadia, hello doctor, watching from Lagos, Nigeria. Please sir, I have been having serious chest pain for a while now. Sir, before I had been treating heartburn, but the pain now radiates to my chest, to my left hand. What is now pain radiating to the left hand or left arm? I know you're meaning this arm when you say hand. This is the hand. This is the hand, but when I know you must be meaning this. So pain radiating here is likely to be cardiovascular in origin. I mean a heart problem. People with angina pectoris. Angina, that is not an area I want to go deep into. I so much concentrate on women fertility and women problems. But I can still tell you, people with angina pectoris, the reason is why it is called angina pectoris. Pectoris means this, the wing. So that pain, people have that chest pain, central chest pain that radiates to the arm, okay, to the arm, and that is likely to be angina pectoris. However, chest pain, especially above the umbilicus, just at the region of that region where the stomach, the abdomen separates from the chest, that region there, most of that pain, all what we call the epigastric region, is as a result of gastric ulcers or GERD, gastroesophageal reflux disease, or gastritis, or peptic ulcer disease. But that radiates to the shoulder or to the arm is likely to be angina pectoris. Nafka Afsa is saying thank you. Did I finish those questions? Treasure, hello doctor, what could be the issue of one miscarriage and a preterm delivery at 29 weeks within 1 year? Now, that can be as a result of, number one, rhesus factor incompatibility. People with a problem with rhesus factor incompatibility, whereby a woman is having a certain blood group, but the rhesus factor is negative, and the man's rhesus factor is positive. Or the man's rhesus factor is negative and the woman's rhesus factor is positive. That woman is likely to have a problem with that. They can have miscarriages and so on. So that can be the problem. Also, what may be clear is that maybe you have some infections that are causing those miscarriages, because we know that infections can cause miscarriages. Or if you have low levels of progesterone, people with low levels of progesterone can also have those problems. Then this one is saying, Claire is saying, they told me I have hormones are slow. What is the cause of it? You're meaning hormones that are slow or low levels of hormones? I don't understand your question, but I know you're meaning low levels of hormones. But again, which hormone exactly has a problem? Claire, ask those people that told you that you have low hormones. Ask them to let you know which hormone exactly has a problem. Because we have very many hormones in the body. Which one has a problem? Let us know. Then we can help you. Nafuka Afiswa, why do you subtract 18 from 32? Why do I subtract 18 from 32? 18 is a figure in the formula. It is a constant. 18 is a constant figure in the formula. You've seen when we were in our high school, they used to give you such formulas. They tell you that area of a circle, area of a circle is equal pi r squared. Now we will ask them, where do they get this to? It is in the formula. So if you're to derive this formula, you'll find out where the 2 comes from. You will again ask, where is a pi coming from? And what is pi, by the way? So these are constants in the formula. You'll find that, so this is a constant. Because when we are calculating ovulation, we say L, which is the length of the menstrual cycle, minus 18, equaling to the beginning of your fertile days, F. So if you want to get ovulation, get F plus 4 is equal to ovulation. These are constants. 4, 18, they are constants in the formula. If you want us to derive this, it will take us a whole day and you may not so much understand. But there is a formula, and it is a long formula. You may not explain. All right, let me get other questions. Nkeiruka Oriema is saying, good evening, doctor. Please, what does fluid in the pouch of Douglas mean? Leaking Graphian follicle. Two fluids in the pouch of Douglas. Now this is another thing. Someone will ask, why do they call it Douglas? So a person who discovered that pouch was called Douglas, and that's why they call it a pouch of Douglas. Fluids in the pouch of Douglas is an indication that you have those fluids in one of the pouches or in one of the pockets in the pelvic region, and that indicates a PID, pelvic inflammatory disease. Some of the signs you'll be having when you have a PID: pain when you're having sex. Pain. I have colleagues that call pain pain. Pain. But you have pain while having sex. Pain while having sex is an indication of a PID. Another thing you'll be having, you may have discharges, you may have lower abdominal pain, etc., 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 and that is because of PID. When you have free fluids in the pouch of Douglas, that's how most radiographers will tell you. Okay. This one is saying, hi doctor, can you help me because they told me I have synacia. Synacia, I talked about uterine synacia. Yes, I talked about it. Doctor, please, what is the meaning of lactate? I've told you. I went for a scan, but they didn't told me the hormone which caused that. Clear. This is a miracle. A scan cannot see hormones. Which scan is that? These pelvic ultrasound scans, they cannot see hormones. They can't. Someone lied to you. If you go to any imaging center, if you go to any radiologist, someone is gifting us. Thank you. If you go to any radiologist, they do a scan. Who is this one gifting us? D Adjust 150. Oh. Adjust 150. Thank you for those gifts. You see, I'm new on TikTok and I don't know the meaning of these gifts. But thank you. I know it's a gift. Thank you so much. And I think others you should also gift. Now, when you do a pelvic ultrasound scan, or if you do a scan, you will not know that you have low level. The scan cannot see hormones. The scan sees only structural features. What does the scan see? You'll be able to see the uterus, the fallopian tubes. You come and invite this person. You'll see the fallopian tubes. You'll see the ovary. You'll be seeing all those structures, but you cannot be able to see hormones. Therefore, if the person did a scan and told you that you have that one, no, the lowest. If you see, if someone does a scan, invite that one. If you do an ultrasound scan and someone tells you that you have low hormonal levels, it's a lie. That person is lying to you, and don't listen to that person. A scan cannot see hormones. Hormones can be seen by using and by doing a blood test. That is a fertility hormonal assay. Yes, DJ Dokit is called Dokita DJ Jaiso. Yes, what is ask your question? I see it's you who gifted us. You want to ask a question. Yes. How are you? Where are you calling from? And what is your question? All right. We're having doctor, please, what can I use? I have done H. pylori test and it was negative, and my chest is paining, and I'm palpitating, and I am palpitation. You have palpitation. All right. You have palpitations. You have chest pain. Now this is your problem. This is your problem. What you are going to do? You said you've done H. pylori and it was negative. H. pylori tests for duodenal ulcers. You may be having purely gastric ulcers. And if you have gastric ulcers, H. pylori may be negative, but you still have ulcers. So negative H. pylori doesn't mean that everyone get this. Now this is very important. It is very, very important for everyone to know this. Most of you have had signs of ulcers. You really feel like you have abdominal. whatever sign they are talking about ulcers, you have those signs. But you go to the hospital, they do a test, a blood test, and tell you H. pylori is negative, therefore you do not have ulcers. Is it true? No. We have two types of ulcers. We have duodenal ulcers, which are caused by increased levels or high H. pylori clonation. You have a lot of Helicobacter pylori bacteria that have invaded your duodenum. That is when you do an H. pylori test and it is positive. But at times you may be having a gastric ulcer, peptic ulcer, the gastric one, the stomach ulcer, which is caused by high levels of hydrochloric acid in your stomach. That may show negative results on H. pylori. So, what you are supposed to do is to do what they call endoscopy. Who asked this question? It's called, I want to direct you very, very well. Oh, this question is running out, but you got. You're supposed to, Oleurua agbaja, you're supposed to do endoscopy. An endoscopy is a technique, it is an imaging technique whereby the doctor or the radiographer or whoever is doing that test gets something like this. It resembles this, but very small. They insert it into your mouth. You swallow it. It enters your mouth. It passes through the esophagus. It goes into the stomach. When they want to check for ulcers, gastric ulcers, or any ulcers, any type of ulcer, they do endoscopy. It passes into your mouth. It goes through the esophagus. It goes and reaches the stomach. Now that item has a camera. It has a camera which is connected to a computer outside. So just know that you'll be like this. A tube entering your stomach and is moving out, connecting to a computer or a screen. That camera will take pictures in your stomach. It will take snaps, pictures. It will take selfies. And now, those pictures which will be produced are the ones we are going to observe and find out whether you have ulcers. Ulcers are lesions, wounds in the stomach, wounds in the duodenum. Therefore, if we find them, you have ulcers. H. pylori is not the only test for ulcers. And by the way, H. pylori is also of two types. Sometimes you do blood, H. pylori, negative, but stool or feces, positive. So, I guess you get me. Many questions. Yeah. Okay. This person is called DIJA150. Thank you. Then another question is saying, Doctor, we pray God helps you and we open another branch in Kampala. Some of us come from very far. All right. Thank you. This one is saying, Obed Bunje is saying, good evening, doctor. What causes ovarian cyst? The most important, there is noise. The most important cause are infections. Infections, PIDs, commonest cause. Mutoni Angelique, hi doctor, I would like to ask you, if you follow the medicine prescribed by your doctor correctly, when do you have irregular periods? The doctor prescribed me metformin and letrozole. Now I stopped metformin. Mutoni Angelique, what exactly do you want me to say? What is your question clearly? You're saying, let me repeat. Hi doctor, I would like to ask you, if you follow the medicine prescribed by your doctor correctly, when do you have irregular periods? The doctor prescribed me metformin and letrozole. Now I stopped metformin. Sincerely, I don't get your question. I don't get your question. Please ask the question clearly. This one saying, doctor, is period for 1 day normal? 1 day period is not normal. 1 day period, having bleeding for only 1 day, at least it should be 2 days. 1 day which is heavy and another one is a little bit light. That is a little bit normal. Yes. Madu Usenide. Hello doctor, you are doing a great job. I have hyperactive of breast milk coming when pressed. Please, how long can I take those snacks to stop the breast milk? Sometimes we take it up to 6 months. Yes, up to 6 months, but of course you should be doing serial reviews. You should be doing those tests again to find out if the level if you've normalized. Mutoni Angelique, sincerely, I didn't get you. Let's then, doctor, repeat for me the name of that full fertility test, cause I've just tested. Cause I also need. Yeah. Dija Bubari, first hold on. Just press mute. I'm going to invite you later. Press mute. There is noise. Press mute. Let me first answer this question. I'll get to you. So. Okay, sir. This one is saying, doctor, repeat for me the name of that full fertility test. The full fertility test, it is called a fertility hormonal assay. Fertility hormonal assay. Tests involved when you want to know whether you are fertile, you do FSH. FSH is follicle stimulating hormone test. That is number 1. Number 2, do progesterone levels. Number 3, do estradiol. Number 4, do prolactin. Number 5, do luteinizing hormone LH. And number 6, do anti-mullerian hormone or AMH. Those are the tests you can do to find out whether you are fertile hormonal in a hormonal way. So let's go to Dija Bubar. Hello, how are you? What's your name and where are you calling from? And straight to your question.
Yes, good evening. I'm calling from Italy.
You're calling from Italy. Which part of Italy? Which part of Italy are you?
Close to Napoli.
Bolis.
Napoli.
All right. What is your problem? What's the problem? Let me know. Please.
Yeah,
wait. Hold on.
Hold
on. Gradiziva, please mute yourself. We are still having a question from Dija Bubari. Please mute yourself. If you don't, we shall just take it off. Let's first have this person. I will call you. Just mute. Be quiet. Let's have this one. All right, Bubari, go on with your question.
Yeah, sir, I want to understand something for myself.
You want to know the what?
I don't understand. I want to have a baby, but it's so difficult.
You want to do what?
Now, I can't. Hello?
I don't get your question clearly. Please, this person, mute yourself. The second person, mute yourself. If you don't mute yourself, we are going to take you away. All right, mute that person.
Sir, I'm looking for a child over 11 years.
You are looking for a child?
I go to the old doctors. Yeah. I have been for the old doctors. They told me that I don't have any problem. I took all this check of everything. But still now,
Are you?
36.
You are 36 years. Have you ever had any child?
Yes, sir.
How old is that child?
The last one, she's 12 years now, 12 years.
She's 12 years. Now,
Yes.
the child you have, are you still with that same husband, the same spouse, or this is a different man?
No, sir.
I'm saying, are you still having that same man, or it's a different man?
No, we separated with my husband over 3 years now.
You separated with your husband 3 years ago,
Yes, sir.
and this is a new one.
This is a new husband, yes, sir.
All right. Is this husband of yours having any children?
No, sir.
He's not having. How old is he?
34 years.
34 years. Now, you have the first thing to do is to test this man. You need to test this man. Let him go and do a sperm analysis. You may find that your man is not fertile.
Yes, sir, I have already do that. I have already do that.
And is he fertile?
Yeah, they told me that it's so low. It's so low. It's not going fast. It's not going fast. But then,
That's it.
The gynecologist give him some medicine, so he's taking some medicine. After 3 months, he takes the medicine.
That's
So
exactly.
now it's okay.
Now hold on. That's exactly what I'm talking about, battery. That's exactly what I'm talking about. That's why I told you that you must do this test. The man is infertile. For you are fertile, the man is infertile. Until the man is properly treated, you cannot conceive. So what you're going to do, if the sperm is taking medicines, and after treating, has he done tests again to confirm that he's now fine?
Yes, sir. We have already go back to the doctor. They have already checked. Everything is okay for him.
Alright, so
my ovulation, the problem now is day of my ovulation. I can't get it because my period changed.
alright, what is the length of your menstrual cycle?
Yeah, this month I saw it on the first.
No, the length of your menstrual cycle.
Come again, I don't understand you.
The length of your menstrual cycle. Alright, now DJ Abdari, I'm going to invite you.
Write it for me. Yeah, write
I'm
it for
saying length
me. Yeah, write it for me as I get it.
of your menstrual cycle.
Okay.
What is the length of your menstrual cycle?
I only just remember the day of my period and the day my period. I can't understand that.
So now, alright, now what I will tell you.
On the face. I saw my period on the face.
So just a little bit. Guys on YouTube, right now we are disconnecting for seconds and we are coming back in 30 seconds. Just a little bit, don't go away, we are coming back on YouTube. Don't go away, we are coming back. Disconnect and put them back. Just seconds.
Okay.
Watch that video and finish it. You'll have understood what I mean by length of the menstrual cycle. You know your ovulation day. If you don't understand, come back on this live and ask. Or if it's done, you come back next week on a Thursday and ask your question. But it is very clear. There is a very clear explanation of how you can catch out your safe days, ovulation day in an irregular menstrual cycle. Go to ask Dr. UTHUMAN. Find a video called "How to Catch It My Safe Days Ovulation Day in an Irregular Menstrual Cycle." Watch it, you'll get the answer you're asking. Because it's long, I may not be able to explain it to you.
Okay, sir, I want to say one thing.
All right.
After I saw my period on the 1st of September.
Please.
My period. Yeah.
Please, you will not get the answer. First, go and watch that, get that explanation very clear, then we shall be on the same page. I will be back on YouTube.
Okay.
Alright, welcome back guys on YouTube. Sorry for that hiccup, but we are back. DJ Babari, thank you so much. I love people gifting here, though I don't know what those gifts I only see, thank you. I only see roses, I don't know. Thank you so much. Thank you so much, Lydia Bubari. Thank you so much. Thank you, thank you. I love what I see on the screen when I see those gifts, though I don't know what they mean. Thank you so much, Lydia. Thank you, thank you, thank you. Okay. Alright, so guys on Facebook, thank you. Guys on YouTube, you are back. Sorry for that. So let me straight away answer your questions clearly. We have many people are sending roses. Technical team, what do roses mean on TikTok? Thank you so much, guys. I see those roses. Thank you so much. Kesbag. Rose that. All right. People are giving me roses. Didja Abubari, thank you so much. You can get off. Let me have someone else. All right, and thanks for the roses. Someone there on TikTok explain to me what those things mean. I'm used to YouTube where I will interact and on these parts. All right. So Miriam Blessed is saying, Doctor, repeat for me the name of that full fertility test. I talked about it. Wow. Doctor, I'm Esther Ipet is saying, Doctor, I am Esther. I have just tested positive. What can I eat to give birth to a nice looking baby? Congratulations. Someone here, Esther Ibet, has tested positive. Thank you. I feel so good when my followers finally conceive. That is very good. Thank you. Thank God that you've conceived. That is very, very good. Esther Ibet, please send congratulations to Esther Ibet. Send congratulations to Esther Ibet. Those of you on YouTube, send congratulations to Esther Ibet. What are you supposed to eat? Eat healthy. A pregnant woman should eat healthy. By eating healthy, we mean just eat your balanced diet. Eat everything you can find on the plate. A pregnant woman is supposed to eat food. Everything they find on the plate, they are supposed to eat. Okay? They are supposed to eat. Just eat. But what you should avoid is what I may tell you. Other things, just eat. Make sure that you eat healthy. Balance the diet. Put fruits on your diet. Put vegetables on your diet. Put proteins on your diet. Add a little of carbohydrates on your diet. Eat everything. Vitamins. Take foods. Pregnant woman, eat everything. However, avoid alcohol. Esther Ipet, if you are a drunko, if you take alcohol, you are going to avoid alcohol. Okay? You are going to avoid alcohol. Esther Ipet, avoid alcohol, avoid smoking. Avoid smoking, avoid alcohol. Those are the things I can tell you about. Avoid smoking, avoid alcohol. But congratulations to you, and we hope that you give birth to a live baby. Follow my life. I think in one of my videos, I'll teach about the pregnancy journey, what we pass through to conceive. But you've tested positive. I hope you've already started antenatal care. Go to the hospital and do antenatal care as early as possible. In the antenatal care, they'll do tests. They'll check for HIV, check for syphilis, check the urine, give you medicines to increase the levels of iron in your body. They'll give you folic acid. They'll deworm you with mebendazole. They'll give you fancida to give birth to a live baby. DJ Aiso, how are you and where are you calling from? D Aiso, I'm with you on TikTok. It's your turn. Alright, you are muted. Unmute yourself. Unmute if you want to talk to me. Okay, let's see. This one is called Mutoni Angelique. Is saying, get pregnant. I have been trying for 1 year and 4 months to get pregnant. Thanks. I love your teaching. What? Alright, but I didn't get your question. Then this one is saying, Michelle Dabrena, hi doctor, my cycle have always been 29 days. This month it is 6 days late. Kindly advise. When your cycle is 6 days late, number one, you may be pregnant. You may be pregnant if it is 6 days late. Therefore, first of all, do a pregnancy test. Number two, sometimes they delay because of hormonal fluctuations and so on. You can wait. 6 days is okay, but not more than 14 days. When it goes beyond 14 days, then that is an issue. You need to investigate. And if it goes beyond 14 days, go and do a fertility hormonal assay to find out the levels of your progesterone, estradiol, and so on. Go and do a pelvic ultrasound scan. Then those tests will show you what the problem could be if they are delayed. Doctor, can pregnancy stop fibroid of size 4 centimeters from growing? Yeah, when you have a fibroid, and you develop, if you have a fibroid and you get pregnant, there are high chances that that fibroid will first stop growing. It will first stop growing. Why is it stopping growth? Because the moment you conceive, the levels of progesterone start going higher and higher. So when progesterone levels go high, or when the progesterone levels go up, then they affect the growth of a fibroid. Because a fibroid wants a condition where there are high levels of estrogen or the estradiol. That's why women who get fibroids have been exposed to high levels of estradiol or estrogen, and therefore, if you are pregnant, the fibroid may cease to grow. Can vaginal dryness cause infertility and treatment? Vaginal dryness does not cause infertility. Let me tell you guys. You see, with fertility or with conception, we don't mind whether the sex was nice. We don't mind. We don't mind whether you reached orgasm for a woman. We don't mind whether the woman was smelling. We don't mind whether the woman was not shaving. We don't mind about anything. What we look at is that, has the man released into the V? The moment you have unprotected sexual intercourse and a man releases into the V on the ovulation day or on the days when you are fertile, you will conceive. So we don't mind whether the woman was dry or the woman was wet or the woman had a lot of whatever. We don't look at that. What we look at is, have the sperms reached the V? Are the sperms viable? Have they swum? And is it an ovulation day? Have they met the ovum? Kaput, you conceive. So that's it. Doctor, can treatment for bacterial infection affect the menstruation? Not really. There are few drugs that can affect that, but usually most of the drugs that are given, most of the antibiotics, have no problem with menstruation. Maybe about how you can treat vaginal dryness. How you can treat vaginal dryness. Now, vaginal dryness, most times, by the way, some of you say that a woman is dry, the woman is dry, but you'll find that the problem is not the woman. Maybe the man is also not doing the right job. Because women can produce vaginal fluids on different thresholds. Some of them, they just need a touch. Okay? Some of them, they just need a touch. You just touch on someone, maybe those good touches, and then he's already having fluids. Others need to be stimulated. You have to touch everywhere, breasts, everything. You have to, those maneuvers. I know men, those maneuvers you can do to make someone, wait. Now, others need you to first, do something down there. So some women need to first be stimulated. Some women need to first be stimulated down there in order to get fluids. Therefore, if your woman is having vaginal dryness, at times you try different means to stimulate this woman. Maybe having fluids, but maybe you've not reached there, or you've not really known the points that bring about those fluids. So mind about that. However, if a woman is dry and it is really a problem, what we do, we check the hormonal levels. In most cases, the problem is usually low levels of estrogen. If you have low levels of estrogen hormone, then you are likely to have vaginal dryness. And what we do, the treatment, is to use estrogen tablets. There are those that are inserted down in your vein, and there are those that are swallowed, and you get vaginal dryness treatment. Thank you. So let's have a question from Trina B. Trina B, unmute yourself. Let us know where you are calling from, your name, and what you are asking. Your question. Trina B, okay. Let's have someone else. Dara Cynthia, since last month, I have been having heavy milk discharge without any form of foul smell. What can be the cause? Dara Cynthia on YouTube, you're saying you've been having a discharge. Some of these discharges are usually as a result of candidiasis. It can be all right. Trina B is saying can't talk now. All right, you'll ask to be invited when you're okay. It's okay. So some of the reasons as to why someone may have vaginal discharges, or those white discharges, you may be having chlamydia. That is an infection. You may be having candidiasis, vaginal candidiasis. You may be having toxoplasma. In other words, you may be having PIDs, STIs, all those infections down there, and it will cause vaginal discharges. There is another discharge which happens during ovulation, but that only stays for about 2 days. Brenda Muhongo on YouTube, you are saying, hi doctor, since I removed implant, it's now 10 months and I'm not getting pregnant. Yes, it is possible with implants. It is very possible with implants. People on implants, take care. People on implants, that implant contains a hormone called levonorgestrel. Once it is inserted in the body, it can disrupt the progesterone, because levonorgestrel is an analog of progesterone. It disrupts the work of progesterone, and you may end up like that. So 10 months, no conception after using an implant, it means that your hormone is disturbing you and you need treatment. What I advise you, go and check that level and then get treatment for that. Faith Emmanuel, YouTube, you're saying, hi doctor, please, I don't understand why menstruation takes up to 7 days in flow, and I do have heavy thick flow or all throughout, and sometimes I still drip blood when urinating, even after periods. Now, 7 days is not too much. Yeah, it is, but we are not supposed to go beyond 8 days. The maximum is 8 days. Yes, I know 7 days is long, but the maximum is 8 days. So it's still under normal ranges. Yeah, it is heavy, it is long, I agree, but it's still under normal ranges. Some people go up to 10 days, my friend. Some people go up to 10 days. People with menorrhagia. Menorrhagia. And some people have dysmenorrhagia, whereby they have heavy periods, heavy, long, painful periods. Some of them have that. So up to 7 days may not be all that scary. Eve 93 is saying, on 2014, the doc said I have a cyst in my ovaries. I was given strong antibiotics, which I took and they disappeared. And I checked hormonal profile and they gave me metformin for a long time, like 1 year, 2 months. Eve, so what is your question? Eve on YouTube? Yes, I've gotten your story, but what is the question? Okiling Moses is saying, Doctor, after Sayana Press, family planning method, what should my wife do to regain her periods back? Because I'm worried she may not conceive again. Sayana Press, after using Sayana Press, 6 months, you are not conceiving or you're not having menstruation, do a fertility hormonal assay, deal with that. Depending on the results, I know progesterone may be low, you get progesterone supplement. Someone is asking for me right here. Quincy Chacha on YouTube, you're saying, Quincy Chacha, good evening, doctor. Please, my question, what to take to correct low hormonal imbalance? Oh, Quincy Chacha, my followers, you need to answer this link here. Those of you who have been following me on YouTube for a long period of time, this question is yours. Sincerely, I shouldn't answer this question. Please help me. But in the interest of time, Quincy Chacha, you're saying, please, what to take to correct low hormonal imbalance? You see, we have many hormones, and I've been talking about this. All these people following me know that we have very many hormones. So identify which hormone has a problem. First, find out which hormone. Progesterone, is it progesterone? Is it estrogen? Is it luteinizing hormone? Is it follicle-stimulating hormone? Is it prolactin? Which one has a problem? Depending on the one that has a problem, you can get treatment. So we cannot help you if we don't know exactly which hormone has a problem. Okay, this one, Princess. This one is Princess. Princess, what's your name? Where are you calling from? And what is your problem?
Princess Christian.
Princess Christine, yes?
I'm calling from Saudi Arabia.
You are calling from Saudi Arabia. All right, so what's your problem? What's your problem, Princess? Yes, Princess, what is your problem? All right. All right, Eve 93, what? That time my periods, you see, if you break your question, Princess, ask your question. If you're not asking, and mute yourself. We go to someone else. Edith Miroya is saying, hi doc, what is the best treatment for PID? All right, now let me be straight here, because there is also a medical student in year one. year one, medical student year one is also asking the same question here. They want to know the treatment for. But you see, when you're in year one, you're not supposed to know this. This is not the time you're in medical student. If you're doing a bachelor's degree in medicine and surgery, this is not the right time for you to know how to treat a PID. Right now, you're supposed to be concentrating in your anatomy, how the nerves move around, the number of nerves we have in the body, the number of bones we have, the muscles, the supply, and so that's what you're supposed to concentrate. But you're asking about, you've been asking this question, it's now coming in many times. But I will answer because I've got your supporter. There is someone also is a patient, another one, not a medical student, is asking, hi doc, what is the best treatment for PID? That is anything. So I will answer for that. But because you alone, I was not going to answer you as a medical student. So, but best treatment for PID, I will give the following options. Number one, we are going to grade it depending on the level. If it is too much PID, that is mild to moderate PID, and then severe PID. If it is mild to moderate PID, you are going to use tablets, orals. Number one, you can use cefixime tablets, use doxycycline and metronidazole. That is one phase. Another phase, you can decide to use that, or you can decide to use levofloxacin, you use doxycycline, then you use tinidazole. You can decide if you are contrary, if you're not supposed to take doxycycline, you can decide to use azithromycin or clarithromycin in that case. Now, if it is a severe PID, pelvic inflammatory disease, you are going to use injections. You may go for ceftriaxone, my choice, levofloxacin, IV ciprofloxacin, IV whatever, those IVs. Then plus the doxycycline and a tinidazole or a metronidazole. My medical student, I think you've gotten the answer. And also Miss Edith Miroya, you've gotten your answer. Jedida Kinori saying, I'm much thankful, doctor, all right, from Kenya, all right. Grace Dadizi, hi doctor, please can I conceive with accurate uterus? Accurate uterus, what do you mean? SCURAT, what do you mean? Bonjo Obed, doctor, all services at the medical center, because we need to come over there and be attended to. Do thorough checkup. My wife has taken 3 years not conceiving. There is no hospital that has all the services. Can I say, do you have all the services? Because you need to be specific. Which ones exactly? There we also refer patients. There are those services we don't have, and we refer to higher centers, or we send you to do tests from other areas. So I don't know exactly. But for the tests I've talked about, for fertility hormonal tests, we do those ones, abdominal ultrasound scans, those ones we do. But I don't know exactly what we are supposed to do for you. But we cannot say we have all the tests. It will be a lie. Kwagala Lydia is saying, hi doctor, what causes that uterine synesthesia, and can a lady get her normal periods with that issue? Thank you. We talked about uterine synesthesia, a condition whereby the uterus, the walls of the uterus are adhered onto each other, and this causes infertility. A woman will not conceive. So it's asking what causes this uterine synesthesia. Now, number one cause of uterine synesthesia can be, first of all, abortions. It can be as a result of the D and C, dilatation and curettage. It can be any uterine surgery or any uterine operation can bring about uterine synesthesia. Also, we've been talking about PIDs, infections affecting the endometrium. The endometritis can cause uterine synesthesia. Aminat is saying, please doctor, can little breast discharge affect ovulation? Breast discharge in a non-breastfeeding woman is a problem, and it indicates high levels of prolactin. This battery is going down. Okay. For the phone.
Okay. What's the percent?
14.
Then
you can also invite someone here. Come and invite someone. Then Sithabail is saying, hello doctor, can you write for us the name of the medicine that can help shrink the fibroid? The medicines which can help to shrink the fibroid. Medicines that shrink the fibroid. The medicine I talked about, number one, is leuprolide. And another one is called gocelerin. Gocelerin. I hope it's now clear. So those are the names of the drugs we talked about. Leuprolide and goserelin. That. Copy them. You can buy them. You can go to the hospital. Yeah, this is Sithabire on YouTube. Another question. Kadabara Juliet, Doc, the loss of 6-month pregnancy was caused by oligohydramnios, and I have kidney stones. All right, sorry about that. Oligohydramnios. Oligohydramnios is a condition whereby a woman is pregnant but is having less fluids, is having less water, amniotic fluid. There is less water in the amniotic sac where the baby is, because when the baby is in the womb, the baby is always like this and is covered with fluids. There are a lot of amniotic fluids where the baby keeps on swimming, bathing around. So if those fluids reduce in quantity, they can affect the pregnancy. Candice Ayer, BND, saying, Doctor, I am trying. Oh, the question is going. Oh, question is gone. Let's. How will this question go, guys? I'll get it. I have to answer everyone. I promise to answer everyone. So I don't want anyone's question to go away. Just hold on, guys. Let me get this person's question. Wow, now things are mixed up here. All right. Candice, yes, I've quoted the question. I don't want to skip anyone's question. Please always remind me when I skip your question. Invite someone here. Candice Airbnb saying, hi doctor, I'm trying to conceive, but I didn't ovulate on the 14th day. Then on the 23rd of my cycle, I meet a doctor and I was given Fertilion F capsules. For how long can I take this type of medicine? Sincerely, I will not tell you. The doctor that gave you the medicine should tell you, because first of all, what is the reason for giving this medicine? Why are we giving Fertilion in the first place? Yeah, it is a good medicine, but it means that doctor knows why they gave you this medicine. Because I've always told you that with me, I give medicines after doing the test. Depending on the dose, the length of the duration of the medication, the dosage, how many tablets you're supposed to take, depend on what the problem is. But what I know that those medicines are usually 30 in that pack. I will not tell you how long you take this medicine. Please ask the doctor, because sincerely I'm not so sure about the reason as to why he decided to give you this medicine, and that's why I cannot tell you how to take that medicine. So okay. Ankara B, what's your problem? Where are you calling from? And what's your problem?
I was inquiring how possible
What's your name and where are you calling from?
Sarah, Uganda. I was asking how to turn the breech baby at 38 weeks.
How to do what?
Turn the breech baby into a cephalic position for vaginal birth.
Oh, how to turn a breech baby into a cephalic position for vaginal birth. Now, this one is asking, because at times you are pregnant, they do an ultrasound scan, they will tell you that the baby is seated in your uterus. it is a breech presentation, because the normal presentation is when the head is facing down, which is called cephalic presentation. But this is abnormal. The baby is seated. Now, there is no medicine in the whole world that can be given to change the baby's position. The baby changes naturally. The baby is always in a changing position. The baby may be at 38 weeks when he's seated in the uterus, is in breech. But by the time you reach labor, the baby has already somersaulted. So you don't do anything. There is no maneuver allowed to be done. Long time ago, they could do what they call internal cephalic version. And internal cephalic version was being done during labor, when a woman has entered labor and is in breech presentation. You can put your hand there, you pass it through the V, you enter the uterus through the cervix, go there, hold the baby from inside. As you're putting your hand up, you have your hand, now this is the woman, this is the belly. You put this hand up, outside, on the belly, on the abdomen, then this one is in the V, you enter into the uterus and change this baby. Internal cephalic inversion. That procedure used to be done long time ago. And also there was also an external cephalic version, whereby you hold this baby from outside, you don't enter inside, and try to maneuver and change the baby. They used to be done. But these maneuvers caused a lot of mortality. Many women were dying because doctors were doing this, midwives were trying to do this. Many women were dying. And therefore, these procedures are obsolete. We don't do them. When a woman is in a breech, deliver a breech. If a breech cannot be delivered, take a woman for cesarean section. I hope you get me. No one should ever lie to you that there is a medicine you can take, there is an injection, give me some money, I give you tablets to change your baby. That is a lie. Doesn't exist in the whole world. Are we clear? Ankara?
Yes. Yeah.
Alright, any other question you have?
No, thank you.
Alright, nice time. Topias Chomohendo is saying, Doctor, I was recently diagnosed with cervicitis. You were diagnosed with cervicitis, yes. My period stopped in March. Is it a condition that can be treated? And again, my reproductive health, because I still want children. Cervicitis can be treated. Cervicitis is in most cases caused by infections. Cervicitis is part of PID. You get antibiotics and treat the stuff. Cervicitis is easy to treat. Just go to the doctor, they give you antibiotics. Yes, cervicitis can be treated. Come here, Beatrice is saying, I need your help, doc. I have my operation 6 years ago, but they operated me twice. Up to now, I'm not yet convinced. And the babies they passed away. What is your question? I need your help. I have my operation 6 years ago, but they operated me twice. Okay. Up to now, I'm not yet convinced. Or you say convinced or conceived. All right. Maybe you've not yet conceived and the baby is passed out. All right. So you had operations 6 years ago, and right now you've not yet conceived. Now, which operation was done in the first place? Was it a cesarean section? Was it an operation for fibroid, intestinal obstruction, or any other operation? We need to know that. That is number one. Number two, you need to carry out tests. For example, an ultrasound scan to find out whether the uterus, you need to do an HSG to confirm that you do not have blocked tubes. Why? Pelvic surgeries, abdominal surgeries, can lead to blockade of tubes. Therefore, the best person is that one that goes on and does an HSG X-ray to confirm that they do not have blocked tubes. Again, you should also do fertility hormonal assay to confirm that your hormones are normal. And that's all. DJ, sir, you didn't answer me. See, which question is that? DJ, I'm ready to answer you. You asked for to be invited. We invited you and you don't talk. But what's your question? Let me know. Let me know. Let me know your question. Please type your question again, or just come live and ask that question. I allowed you, you even gifted us. Why shouldn't I answer your question? Doctor, I was operated. This one is best work. You get to know that question. Let me first say that question. Best worker 99%. Doctor, I was operated adenomyosis in April, but up to now I haven't conceived. Really? April and now, this is a short period of time. First give it some time. First give it some time. If the operation was successful, you will conceive. Okay, DJ or DY something, ask your question again or come live. I accepted you, but I think you have a problem with your network maybe. This one is saying, Evelyn Joseph, now are you a female or male? Evelyn is for females and Joseph is for males. I don't know. Alright, Evelyn Joseph is saying, I have a problem, doc said my uterus far, what can I do to come near? The uterus is far. Ask your doc again what they meant by the uterus being far. I don't know what that means. I've not seen a uterus that is far. Far from where? Far away where? Where is it? Is it in the stomach? Is it in the chest? So I don't know what that means really. I need a baby. I can't help you because that diagnosis I've not heard about it, where the uterus is far. Please doc, is it possible to have ectopic pregnancy twice? Yes, it is very possible to have an ectopic pregnancy twice, even, I don't know, many times. You can have an ectopic pregnancy as many times as possible. Me, I'm just camera taking self in the stomach. Yes. yes. When we are doing, it's called endoscopy. Yes, we put a camera in your stomach and it takes pictures. DJ is saying, if your tubes is blocked, can you have your person? If your tubes is blocked, can you have your person? What do you mean by person? If your tube is blocked, please, can you have your person? Your periods, all right. If your tubes are blocked, can you have your periods? Yes, and a very big yes. Who told you that blood comes from the tubes, the fallopian tubes? Blood comes from the underlining of the uterus, the endometrium. So blood doesn't come from the tubes and doesn't pass through the tubes. Blood comes from the womb. Blood comes from the womb. It comes from the uterus. It is as a result of shedding of the endometrium. There is no relationship between blocked tubes and menstruation. So you menstruate whether you have blocked tubes or they are open. Yes, my guys on YouTube, I'm back to you. Khadija Lukman is saying, please, I need your help. What do I do, sir? Which one? Okay. After going through ectopic pregnancy operation since 2 years ago, till now, it is difficult for me to conceive again. If you had an ectopic pregnancy 2 years ago and you're not able to conceive, now, my friend, confirm that your tubes are not blocked. Khadija Lukman, confirm that your tubes are not blocked. Tomorrow I'm releasing my video about blocked tubes. Whether someone can conceive with one tube open. Be ready to receive that video. It will be at 8 p.m. or 20 hours East African time. we're going to release that video on my YouTube channel, Ask Dr. UTHUMAN. Find it there tomorrow. I'm talking about that. But to answer this quickly, if you had an ectopic pregnancy, maybe they did an operation. Yes, you had an operation, and it is possible that these tubes were cut, because some people, when they develop, when they have an ectopic, the remedy, the medicine they are supposed to be given is an operation, a laparotomy, whereby we enter inside and get where the fetus is on the tube, cut out that part. Actually, when you get an ectopic, for example, what we call the tubal pregnancy, the fetus or the baby may be here on the tubes. And the role of the doctor is to enter there and take away this baby. Okay? But sometimes it becomes impossible to separate this baby from the fallopian tubes. And therefore, at the end of the day, the doctor may cut off this part of the fallopian tube, and the tubes may be blocked. 2, even if the doctor didn't cut away or didn't cut off that part, it is possible after the operation for you to get adhesions. When you get adhesions, they will block the tubes. 2, it is possible that you got scarring of the fallopian tubes and they got blocked. So you need to find out if that is what happened. Then Mandu, so Khadija Lukman is saying you did my help. Of course, I think you've gotten the answer. Then Mandu Usaina is saying thank you so much and God bless you. Thank you. Bonjo Obed is saying my wife men's period day is 29. When is her ovulation day? All right. I will not get tired of telling you your ovulation day, the day you're supposed to get pregnant, your fertile days. Now get it right here. If you want to know your ovulation day, you want to know the day you're ovulating, the day you're supposed to get pregnant, the fertile days, we said we are going to use this. Get me right. You must know the length of your menstrual cycle. Get length of the menstrual cycle L and subtract 18, which is a constant. The answer you get is the beginning of your fertile days. Get the answer of the beginning of your fertile days, add 4, you will get your ovulation day. When you get your ovulation day, add 5, that is the end of your fertile days. So for example, you're saying the length of your menstrual cycle is 29. We shall get 29 minus 18. What do we get? 29 minus 18. Someone give me answers. 29 minus 18. People don't know mathematics here. 11. Someone is telling me 11. Thank you. So 29 minus 18, this is who? Vicky Joel is saying it is, you get 11. Thank you. This one did mathematics. So 29 minus 18, you get 11. Hey, many people are now answering 11. Thank you. You are attentive. 11. All right. So you get 29 minus 18, you get 11. So 11 is the F, the beginning of your fertile days. So get 11, which is the F, and add 4. You will get 15. This is your ovulation day. Get 15, which is your O. 15 plus 5, you get 20. That is the end of your fertile days. Now, what am I meaning, Mr. or Miss or Obed? Bunjo Obed. Mr. Bunjo Obed. If the length of the menstrual cycle of your woman is 29 days, on the 11th day, she is fertile, she can conceive. From the 11th day up to the 20th day, she is fertile, she can conceive. Therefore, when you see your periods, when she sees her periods, let her count day 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, she's safe, she can't conceive. Day 11, she will conceive, she'll be able to conceive. 11 up to 20 days, she's able to conceive. Now, 15th, is her ovulation day. 15th is her ovulation day. On this day, if everything is okay, she will not fail to conceive. On this day, she will not fail to conceive. That is the day she's very, very fertile, and these are the days a woman is able to conceive. Bonjo Obed, I guess you have the answer. Some people asking to be invited. Alright, many congratulations are coming in for Esther, who conceived, is our follower here. She's been wanting to conceive, like, she's conceived. Congratulations to her. All these messages are now congratulatory messages for Esther, who conceived. Come and write this one. Who conceived? Alright, let me go to the questions now. All these are congratulations. Alright. Chioma Nkwako. Chioma Nkwako, where are you from? Nigeria or Ghana? Sound to be Nigerian. Chioma Nkwako. Chioma Nkwako is saying, please, I have 3 girls. I want a boy. I need help. If you want to have a boy child, I told you, have sexual intercourse on the ovulation day and avoid the other days. So in that particular month, have sex once on the ovulation day. Miriam, blessed is saying, and doctor, we thank you for always not getting tired of us. We thank God for you. Thank you. Thank you. Miriam, blessed, it's men's problem. Doc, they don't know how to romance women. Hey, someone is saying that men do not know how to romance women. Miriam, blessed, you must be experienced here. Okay, all right. So, yeah, it is true that some men really don't want to romance, and someone comes, they just want to enter. So how do you expect a woman to have those fluids? You want them to have fluids, to have water, but you don't want to romance them. This is what Miriam is saying, and I agree totally with her. I totally agree with her. All right, another question. I want pregnant, but now 2 years. Any problem? I want pregnant, but now 2 years, but I don't have a problem. Selami, why are you saying you don't have? Ask to be live. There are some questions I want to ask you. Ask to be live. I need to ask you several questions. With that question, you need to explain to me very well, and we get a solution for you. Ask to come on live. Doctor, please, can a woman get pregnant at age of 45 years old? Yes, very, very possible. Of recent, I think this month alone, this is September. No, in August we had 3 of them. Is it 3? Let me check my records very well. Yes, we got 3 women who got pregnant. This one is 47, 50, and 56 years. So it is very possible for one to get pregnant at that advanced age, as long as interventions are made. Come and invite this person here. I want to ask questions. Khalifa Kafira is saying, good day doctor, please, how long will it take for me after paying for audio consultation to get an appointment date? An appointment, as long as, because when you ask for an appointment on our website, our technical team looks through because there are always many people asking. Now, depending on the time you've made that appointment, they will schedule. And when you are scheduled, they will give you, because sometimes you take a 1 week, other people take just 1 day, depending on, because some people ask for urgent appointment, emergency appointment, and then others ask for just the normal one. So they can schedule, you can take between 1 day and 3 weeks. Some people can be answered immediately, but now, if you don't get answered in those days, I'll ask you to to send a message on this number. Just hold on. I need the other number. I'm going to ask you to send a message on this number. I'll send you a message. I'll write the mobile number where you can send your message if you really booked an appointment and you're not getting answered. All right, let's come to TikTok. Who is asking? Who is asking? This one is called Tanga T. What's your question? What's your name? And where are you calling from? Tanga T. All right. All right. We have another question. It's saying moving blessings. Is saying I was going 70 days, then I turned 27 days. I was going 70 days, my periods. When I turned 27, I got hormonal imbalance. I went to doc. She gave me medicines until now. My period is 4 days. God is awesome. All right, thank you. So this one had hormonal imbalance, got medicines, and it's fine. All right. Then this one is saying, thanks, doctor, fertility hormone. All right. Khalifa is saying, doctor, is it possible for me to be on my ovulation period without knowing the time an egg was released from my ovaries? Of course you will not know. You cannot know the time your eggs have been released from the ovaries. But we know that during ovulation, the egg will be released. Okay? But we cannot know the exact time the egg is released. Charity Kamui saying, good evening, doctor. What medicine can one trying to conceive take to wash away Depo Provera in the body? The Depo got expired in May and the menses are now back to normal. Now, Depo Provera, yes, it can get expired, but sometimes it goes up to 6 months. So at times, you are advised to first wait for a period of 6 months for you to start complaining. Okay? You are advised to first wait for a period of at least 6 months for you to start complaining. If 6 months pass, then you can pass through the other means we talked about, being fertility hormonal assay, to find a solution for yourself. Battery for the phone, as if it's not plugged in. Grace is saying, congratulations, Esther. Sally Banda, I said, really, Sally Banda, I will not be able to calculate for you. You've given me a lot of details. December 2022, 43. All right, let me pass through December 2022, 23 days, 29 days, 25 days, 27 days. All right, 23 days, 17. Okay. 20 days. Now, Sally Banda, Sally Banda is trying to give me different length of the menstrual cycle, and from what I'm seeing, it's like 25 is the shortest day, the shortest length. So if 25, I'll come with for you, Royana. First wait, let me first finish Sally Banda on YouTube. So it looks like 25 days is the shortest, is your shortest cycle length. So what you're supposed to do, get what we did here. First hold on. Loyana, first mute yourself. Let me first answer this. So what you're going to do, get 25, because the length of the menstrual cycle shall take the shortest, which is 25. 25 minus 18, you will get 7. 7 plus 4, you will get 11. 11 plus 5, you will get 11 plus 5, you will get 16. Your fertile days, Sally Banda, begin from 7th up to the 16th day. You are fertile from 7th up to the 16th day, and your ovulation day is on the 11th day. Try having sexual intercourse on the 11th day. You'll be able to conceive if there is no problem. Okay, let me go to TikTok. Royana, what's your question? Where are you calling from? And what is your question? Unmute yourself. Battery. Come to 6. Battery. Royana, what's your problem? Unmute yourself. Unmute yourself. Did you mute her? You muted her? Unmute her. Alright. Unmute. Go back. Hold the phone and unmute. Jamie Katz, good day, doctor. Okay, take it out. Unmute yourself if you want to speak to us. Jamie Katz saying, good day, doctor. Please, doctor, can someone bleed after terminating a false pregnancy? And what? Yes, you can bleed. You can bleed. When you terminate pregnancy, you'll bleed. Yes, what are you saying, Loyan?
Hello.
Yes, please. How are you and where are you calling from?
Yeah, I have a question. This year.
What's your name and where are you calling from?
My name is Lavina. Right now, I'm in Holland.
You're in Holland, Dutch, Netherlands.
Yes.
Why is Holland called Dutch? It is called Netherlands. Why all those names?
Well, that's what I can't explain it well. I don't know who did it, but yeah, if you like, you can call it Holland or Netherlands.
All right. So what's the problem?
Okay, my problem is this year May I did a surgery, tuboplasty.
In May you did tuboplasty, yes.
Yeah, tuboplasty. So they say the result was one tube was damaged and one was good, but they did adhesion. So after that, I've been trying to conceive, but I don't know why I haven't conceived yet.
How long ago was the operation done?
Sorry?
How long ago was the tuboplasty done?
Yeah, it was on May 27th this year.
May 2017.
May 27th this year, May this year, 2023.
All right, May 2023. How old are you, Royana?
Right now I'm 35.
You are 35. Have you ever produced any child? Have you ever given birth?
Yes, I have a child. My daughter is 17 and in this October she's gonna turn 18.
All right. Are you still with the same man? Or this is a different one?
No. I gave birth to my daughter at a young age, and yes, at
So you're
around
married to
14,
someone
15
else
years
now?
then. Yes.
All right, you are married to someone else. Thank you. Now, how old is this man?
Right now he's 57.
He's 57. Does he have any children?
No. He didn't think of that before, but now he's ready for it.
Okay. Have you done a semen analysis, sperm analysis for this man? Has he done sperm analysis?
Not yet. We've not reached that.
Rohana, you're called who? What's your name?
My name is Lavina.
Lavina. Then you've not done anything. You need to investigate. First, do a semen analysis or a sperm analysis. Find out whether your man is fertile. You may find that your man is also not fertile. Yes?
You are right, but now now let's talk about my issue. So
Yes,
what
see.
can you tell me about that?
No, you see, let me tell you. Fertility is when we are managing fertility, we use what they call a holistic approach. You don't just tackle one issue. That a woman has blocked tubes, you've unblocked the tubes, and you expect her to conceive tomorrow. You have to also consider other factors. What about the man? Is he okay? Because they unblock your tubes are parted, but the woman is infertile. The man is infertile. How will he impregnate you? So we must be sure that the man is fertile. When the man is fertile, then we can, because the tubes were unblocked, we now expect you to conceive. If you do not
You know,
conceive, then either the man has a problem, or maybe the procedure wasn't successful, or you have other problems like hormonal imbalance.
Yeah, but I did surgery and the result was out, and they said one tube was damaged and one was good, but they do adhesion on it, so they said it's open.
Yes, so if the tube is open, then it means
Uh-huh.
you can conceive. Are we together?
Can I conceive with one tube?
Yes.
Okay.
Lovana,
Yes.
have you been following me on YouTube?
I've been following you even on Facebook. I started following you a long time ago on YouTube, and I sent you a message some years back, but you never replied. So today I just come up on your. I got you on WhatsApp and on TikTok, and that's why I said let me try if this time you can accept my request.
All right. Sometimes many people send messages on Facebook. They've sent many messages in my inbox and so on, and I cannot answer everyone because they are very many. That's why I put a private chat where someone goes to the website and books an appointment. But if you've been following me on YouTube, you subscribe to my YouTube channel. Tomorrow at
Yeah,
exactly.
I subscribed on your YouTube channel and I sent you a message, but you never replied.
Sorry, there are many messages. I'm sorry about that. Tomorrow, go to my YouTube at 8 p.m. That is 8 p.m. or 20 hours, 20:00 hours East African time. I don't know what the time will be in Netherlands. Tomorrow I will be premiering a video about able to get me, then you'll understand that. Okay?
Thank you, doctor. Let me give a space to other people.
All right. Nice time. God bless.
Okay, thank you. God bless you too.
Okay, Ruvarian.
You can remove me, please.
Ruvarian. Why don't you see? Okay. So let's have.
Kindly remove me, doctor, so that I can give space to other people.
You take off. Just hang up. Just click there and hang up. Ruvarian, hello, how are you? Where are you calling from and what's your problem?
Hello, doctor. I'm Ruva from Zimbabwe.
Uvarian from Zimbabwe. How is Zimbabwe? How is Nelson Mnangagwa?
That guy is making us suffer. Now we are all sick because of him.
But you don't like Mnangagwa, but you chased my friend Robert Mugabe, and now you have Mnangagwa again, you're crying.
Just Robert because of his wife, but God rest his soul. So anyway, doctor,
What's the problem?
I've got it's a long story. I fell pregnant in December, and then in February, I bled for a few hours, and I had a scan. They said the baby is gone. So after that, I kept on having lower left abdominal pain for a while. And then I went back and they said I should do another scan. And then that's when they said I've got a growing placenta without a baby. I think they said a blighted ovum or something like that. And then I was supposed to go for a surgery. But before it happened, the ovum, it ruptured and I hemorrhaged and lost a lot of blood. I had to go for an emergency DNC operation to stop the bleeding. So I became anemic. My HB level was around 6.5. So I was on iron supplements from then until 2 months ago. But ever since I had that incident, my period hasn't been normal. Sometimes it comes very lightly with really dark clothes, and it's very, very light, and I still have that lower left abdominal pain. I don't have any discharge. I was tested for cancer, cervical cancer a few months back. It's not that. I went for another scan. They said there are no abnormalities seen, no fibroid, no cyst, no what. But I keep having this lower left abdominal pain, just near the end of my tummy there. And sometimes it circulates back to my lower back. Yeah.
So I want to get you clearly. You were pregnant and you got a miscarriage.
Yes. And 8 weeks, that's when I bled for a few hours.
Yes, 8 weeks, you got a miscarriage and they did. Go slow. I want my people to understand. You were 8 weeks pregnant, you got a miscarriage, and they did a D and C.
No. I bled at 8 weeks, and when I went for a scan, they said I'm no longer pregnant, I lost the baby. But then the remaining tissues were so small according to them that they gave me antibiotics. They didn't do the DNC. And then I kept on having pain afterwards. And then I went back for a scan. So the scan was saying I've got a 12-week placenta without a baby. It's like the placenta was growing on its own without a baby inside. So then they said I should do a DNC. But before I could go for the appointment, the placenta ruptured, and then I started bleeding profusely that I had to have the emergency DNC. So after that, my
You see, the story is long, but that's why in summary you did a D and C following a miscarriage, or what you call a missed abortion, or an embryonic pregnancy, isn't it so?
Yes, that's what they said, but they said the remaining tissues are so small that
Yes, and you did a D. The point I want to get is that you did a D and C.
Yes, they did, but they did it when the ovum ruptured.
Yes. Whatever the case, we still call that a miscarriage. So it was a miscarriage, and you did a D and C. Now, during the procedure, when they are doing a D and C, sometimes there is damage to the tissues, to the walls of the uterus, and you end up with endometritis. And if someone has endometritis, they will keep on having lower abdominal pain. They will keep on having, invite someone, they will keep on having lower abdominal pain. Sometimes they keep on having bleeding. Their bleeding, they will have irregular menses, okay? They even bleed when it is not yet time for them to bleed, and so on. So that is likely to be an endometritis that you need to treat. So I would advise that you go on and because if, first of all, you may change the facility to do a scan from another facility. If that scan is not able to detect anything, go and do a hysterosalpingogram. A hysterosalpingogram, that one will probably may be able to detect the abnormality that is in the uterus and anywhere there. If all that fails, then you can do a CT scan. Computer tomography is more sensitive than the ultrasound scan. You can do a CT scan or do an HSG X-ray, that is a hysterosalpingogram, to identify the real problem that is happening and get treatment.
Yeah, I think that would be best because I'm now having other symptoms like headaches. Sometimes I
You
have
see,
dizzy spells.
yes.
Although I am hypertensive, I'm on treatment for hypertension. I take amlodipine and bisoprolol.
Yes.
But could this be
No,
the reason
no,
why
it is not
I'm
a-
having all other symptoms?
No. What the side effects of those medicines, that is not one of the side effects of the medicines you're talking about. Are we together? The other medicines have no problem with the fertility. So you can continue taking your antihypertensive drugs, the drugs the doctor gave you, it is okay, continue taking them. There is no problem with them, okay? Call Judge on live.
Yes.
Alright, so do those tests, get us a feedback in the next live, okay? Do those tests.
Sorry?
Do those tests, get us a feedback, Jojo. Do those tests, get us a feedback in the next live, okay?
Okay, thank you, doctor.
Alright.
Thank you so much.
Alright, now we are going to have Tonga. Tonga, you've been coming on live on and off. What's the problem? How are you? Where are you calling from?
Good evening, doctor.
Good.
I think you're watching from Zambia.
You're watching from Zambia.
Yes.
Alright, what is the problem?
Okay, I was 3 months pregnant.
You were 3 months pregnant, You are off.
From there, I'm eating.
Please be loud. Please be loud. We are going to take you off and go to someone else. You were 3 months pregnant and you got bleeding. I want to clear you. Then after that, I go to YouTube and then come back to these other two people.
Yes, before they did the scan, I was told the placenta that
Tonga, first get network and come back. Let's go to someone else. First get a good network and come back. Mbaba's Erina, how are you? Mbaba's.
I'm good, how are you?
I'm okay.
Good work.
Thank
Yes. Good work, doctor. Thank you so much.
you. Who am I?
Now, me, I want to conceive, but I find
You want to
I'm from
conceive?
Uganda.
Okay. Where exactly in Uganda?
Yeah, I find
Where?
in Kampala.
So you said you want to conceive and you failed to conceive.
Kampala. Yeah, I failed. I try. But when I'm going to hospital, it told me that I don't have any problem, but I have some mucus on fallopian tubes. Maybe it's the one stopped to me.
Have you?
But he told me I go and I wait. So now
I don't know what happened with my phone.
Alright. Other people, please mute yourselves when one is talking. I'm with Mbabas. Alright. So have you done a fertility hormonal assay?
yes, I know hormone balance I did.
Have you done an HSG X-ray?
Yes.
And is it normal?
The result was good.
Was good. All right. So
yeah, even some. Yeah.
can you
Scan.
do for us an HSG X-ray? Come back with those results in the next live, and we help you.
Where can I find you, doctor?
I'm in Masaka, Bikoff Medical Center in Masaka.
You are in Masaka?
Yes.
So even tomorrow I can come there with my results?
No, I'm always available on Monday and Tuesday only. Monday and Tuesday only.
So how can I get your number?
No, I don't give out my number. If I give out my number right now, I receive like 1,000 calls today. So you just come to the hospital if you need us.
For me. I'm
Please.
new fry here. Help me, dear.
Have a nice time, please. I can't give out my number. I don't give out my number. Reason, and you know that I have many followers. I cannot concentrate when I give out my number. So you've known the hospital, you've known what to be done. Nice time. Let's give other people a chance.
Okay, which hospital? Which hospital, please?
It's called Bikoff Medical Center.
Piku.
Let me write it for you.
Okay.
It's Bikoff Medical Center. You've seen it?
Yeah.
Bikoff Medical
Okay.
Center in Masaka. That's where you can come, you will find us. Monday and Tuesday, ask for Dr. UTHUMAN.
Okay, doctor, thank you.
When you come to Masaka, the clinic is opposite Club Ambience. I know you know Club Ambience. So opposite Club Ambience, that's where we are. Thank you so much. Have a nice time. Let me first answer my guys on YouTube. You people who use 355, I'm coming for you. Stay there. Stay there. Let me first answer a few questions on YouTube. I'll come for you. I'll invite you. Alright, so we have questions here. Wow, a lot of questions are pouring in. Jamie Katz, good day, doctor. Please, doctor, can someone bleed after terminating a false pregnancy? I said yes. Saleban, Dr. UTHUMAN, during my menses, my blood is very dark. What could be the problem? This is Salebanda from Lusaka, Zambia. So the problem may be hormonal. It's as a result of hormonal fluctuations, and sometimes it can so on. Mutoni Angelique is saying, hi doctor, how can I conceive? I have hormonal imbalance, follicular phase less than 3.4, luteal phase 2 to 19, and ovulation phase 2.7. This is example. Mutoni, when you give us fertility hormonal results, you have to give us reference ranges. Every machine that is used, most machines have different reference ranges. So when you tell me about your results for fertility hormones, make sure that you meet the reference ranges. That's when I can know that they are normal or abnormal. Dam Kizi, can a 46 years old woman use Clomid? Yes, it is okay. There is no problem with a 46 years old using clomiphene. So let me have a user 53591. Hello, how are you? Where are you calling from? And what is your name?
I'm called Sharon. I'm calling from Rakai Hospital.
Sharon from Rakai Hospital. Yes, what's your problem?
Doctor, for me, I was just thanking you for your services, but I'll visit Bikoff on Monday or when you're around.
All right. Welcome. Thanks for appreciating. You must be a health worker. You're a medic?
Yeah, I'm a medic,
Yes,
doctor.
you sound so. All right. We meet on Monday.
Okay, doctor.
All right. Nice time.
Thank you.
So So let's go to Emmanuel. Faith Emmanuel is saying, thank you so much, doctor, for answering my question, but why do I still drip of blood when urinating, even after menstruation? When there is blood in urine, case back. Come on, so these people. When there is blood in urine, you're likely to be having a UTI. A UTI will cause blood in urine, especially those severe UTIs that are poorly treated. They will cause. There is Jojo who was asking for to come live several times. I don't know why he's not coming live, but get that. So a UTI can cause blood in urine. Mutoni Angelique is saying, why mites are not regular? I am following the medicine prescribed by the doctor, but I still have irregular periods. You say, I don't know the medicines the doctor gave you. If you have low progesterone, you're supposed to take progesterone supplements, either progesterone injection or progesterone tablets. Yeah, so, but I don't know the medicines the doctor gave you. Angelina on YouTube explain to me which medicines were you given. I use metformin and letrozole. Metformin and letrozole is metformin and letrozole to regularize periods. Maybe you can use metformin and letrozole if you have polycystic ovarian syndrome, what we call PCOS. If you have PCOS, then we can use those medicines. But if it's not that, then we need more clarification. Patrick Akema on TikTok, what are you saying? Ask your question, tell us where you are and what you are asking.
Good day, doctor.
Good evening, how are you? What's your name and where are you calling from?
My name is Sia Patricia Kimbe from Sierra Leone.
You're calling from Sierra Leone.
Yes, sir.
Okay, how are you? What is the problem?
I have fertility issue, and I went to the doctor at Life Care, and they said I have one block fallopian tube. Can I get pregnant?
All right. Have you been following me on YouTube?
Yes.
Thank you. If you've been following me on YouTube, tomorrow, okay?
Okay.
Tomorrow at 8 p.m. East African time. I don't know what the time will be in your country.
Okay.
Let me see. So we are 3 hours ahead of Sierra Leone. Therefore, at 8 p.m., you tune in at 6 p.m. Okay? Is it 6 p.m.?
Okay.
This back. What time will it be? Oh, you tune in at 5 p.m. your time in Sierra Leone. At 5 p.m., go to my YouTube channel, Ask Dr. UTHUMAN. I'll be premiering that video about whether it is possible for you to conceive with one tube. I will be explaining that very clearly at 5 p.m. in your country. You'll find that video, okay? Check my YouTube. It is a clear explanation. I'll give it. All right. User 5391, please say your question. How are you? Where are you? And what's the problem?
Good evening, doctor.
Good evening to you. How are you?
I'm okay, doctor.
What's your name and where are you calling from?
Calling from Masaka.
From Masaka here?
Yes.
All right, so what's the problem?
The problem is PCOS.
Yes.
Yeah.
You have polycystic ovarian. You did the scan?
Yeah, I did a scan, ultrasound scan.
All right. Have you done a fertility hormonal assay?
No, not yet.
Then we are supposed to do fertility hormonal assay. Then we shall be correlating the results of the fertility hormonal assay and the results of the scan. Then you can get treatment for that.
So do you do the test on before?
Yes, we do.
Okay. I'll be there maybe on Monday or Tuesday.
All right. Nice time. Which part of Masakayo?
Senyange.
Nyendo Senyange here. Alright, nice time.
Thank you.
Alright, so let's have on YouTube we have Sitha Bill. Thank you for answering my question, doctor. How can I contact you on a one-on-one? I'm in German. Alright, if you want to have a private chat, I said go to my website www.druthman.com. I've put for you the it's actually flowing. If you're following on my channel, it's down there, www.druthman.com. You can book an appointment. I can have a one-on-one with you. Also, those of you who would like to have a chat one-on-one with me, we can go live alone. It can be a private chat, me and you. What you should do, join, become a member on my channel. Go check my YouTube channel, my account. Look for where there is the word join. Press there. You will see the different packs. Then choose any pack. But one of the packs, there is the pack that is one in particular. There is one pack where you can press and then become a member who can be with, who can have an absolute right. You can have a live video with me, explain to me your problem, and you get answered. So you know what to do, Shitha. Then Jameyo, hey doctor, I feel some movements in my womb on the left side and yet I'm not pregnant. I'm worried. What may be causing this? I need your help, please. Feeling movements in the womb yet you're not pregnant. If you are feeling movements in the womb yet you're not pregnant, you are likely to be having a mass. If you have a mass or a swelling in the uterus, if you have a swelling in your tummy, if you have, for example, you have fibroids, you have an ovarian cyst, you have any complex mass, it may be cancer, it may be any mass there, it can cause, you may feel like there are some things moving within your womb, and that could be the problem. So, what to do? Ultrasound scan, get the problem. Then we have Florence Wanjohi on YouTube. You, Mariamu, I'm coming for you. First wait, just be steady there. Let me first take off these questions on YouTube. There are many questions and I have to finish them. Florence, hi doctor, I was diagnosed with PCOS in 2021. Comes this year, I reduced weight and I conceived naturally. Congs without drugs, but it ended up a blighted ovum. Now after miscarriage, which drug can I use? Alright, with PCOS, get the drugs for PCOS. Metformin. Then after metformin, you have also to do a hormonal assay. Let's know the levels of your hormones. Then after doing a PCOS, after doing getting metformin, you can try Litrazole or clomiphene or any drug, then you can conceive. But of course, after doing a fertility hormonal assay, we shall be knowing the levels of your hormones. And because with PCOS, you'll find that even there are some hormones that are affected, and those hormones have to be stabilized. Ruth Kadu is saying, oh, the question is gone. Ruth Kadu, hi doc, what causes sperms not to stay alive in the vagina? What really kills them? You see, I have had these questions. I need to stress this clearly. I have had many people, and there is a video on my YouTube talking about this. Look for that video. It has a lot of the explanation. But I have had people say, when I sleep with my boyfriend, when I sleep with my husband, so the sperms do not enter my IV. They come out, they leak, they pour out, and that is why I'm not conceiving. That is a lie, oh. It's a lie. They will not come out. This is the same scenario where people will tell you that when you have sex, if you have sex while standing, you cannot conceive. Who lied to you? You will conceive. So by the time you even think about pulling out that stuff, sperms have already swum. They are very fast. They are so speedy. The moment they are posted like this there, they enter, they pass through the cervix and enter. So what you will see is be semen and other things, but some sperms will have moved in. So the problem is not that sperms are leaking out, they are coming out. No, that is not the problem. You may be having another problem why you're not conceiving, my dear. Damn, Zekiz, I'm 46. Can I take Clomid? Yes, you can take. Keki Muli Marion, thanks for the show. It's now 4 years not conceiving, and I have tried all methods but all in vain. What should I do? I don't know what you should do because I don't know the methods you've tried. You may say you've tried out all the methods when they are not all. So I would still insist, go to the hospital, get a doctor, get diagnosed. Because if methods, which methods have we tried out? Let first tell us, Miss Keki Muli Mario, what is the problem? Before you try any medicine, identify what the problem is. What is causing your infertility? What is stopping you from conceiving? Do tests to find out what is stopping you from conceiving. After doing the tests, identifying what is stopping you from conceiving, you get medicines. You can now tell us that, I've used the medicines and I'm not getting pregnant. Then Chua Marilo is saying, hi doctor, my period is not normal. It comes after 26 May, 27 June, 27 July this month. Comes after 31 days. What are my fertile days? Thank you. This is simple for me. And I told you I will not get tired of calculating your fertile days. I will not get tired. So the length of your menstrual cycle, you've said it is 31. 31 minus 18, what do you get? Kesba, what do you get?
At what?
31 minus 18.
31.
Someone give me the answer on live here.
13.
31 minus 18 is 13.
Yes.
So 13 plus 4, we get 17. So this is your ovulation day, the 17th day. Miss Chua Maliro. This is your ovulation day, 17th. So when you get into periods today, 1, 2, 3, 4, 5, 6, 7, 8, 9, 17th is your ovulation day. And also from 13th up to, because 17 plus 5, you get 22. So from 13th up to the 22nd, you are fertile, you can conceive. But ovulation day is on the 17th day of your menstrual cycle. I hope you've gotten the answer. So let's have Tangatele. What are you saying? Tangatele on TikTok.
Hi, doctor.
Hi, how are you?
Fine, thank you, doctor.
What's your name? Where are you calling from, and what's the problem?
Yeah, and my problem is that I was 3 months pregnant.
Your problem is what? Be louder.
Hello?
Yes.
I'm saying that I was 3 months pregnant and I suddenly started bleeding.
Yes, you were 3 months pregnant
From
and
there, I
started
went to the
bleeding.
hospital,
Yes.
they did the
Sorry.
scan. Yes, when I went to the hospital, they did the scan. I was told the placenta is detaching,
The placenta is what?
but the fetus was still viable. Detaching.
Yes.
So from there, I started bleeding internally, and I was told the only option was to terminate the pregnancy.
Yes. So you terminated the pregnancy at 8 weeks.
No, at 13 weeks.
At 13 weeks. Yes.
Yes, through MVA procedure.
MVA. Yes. So you did MVA at 13 weeks. Yes. So what is your question?
My question is, what normally leads to the placenta being detached or getting detached?
Placenta being detached from the side. Of course, when you are to have a miscarriage, the placenta gets detached from the uterus.
Yes, but it's detached before the miscarriage.
Yes, of course, that is the way to the miscarriage. So the question would be, what is causing the miscarriage?
Yes.
Because and by the time we started that small bleeding, it means the miscarriage was in progress.
But when they did the scan, I was told the fetus was very viable.
Yes, you see, when someone may be dying but is still alive, you get knocked down, you start bleeding. They find that the heart is still beating, but you're going. Are you getting me? So they can do a scan and find that the baby is still normal, is still alive, though the process of miscarriage, because the process has started, because the process has started, and to show that the process has started, the placenta has already detached itself from the uterus. That means the process has started. So that your question would be, what might have caused my miscarriage?
Okay.
So one of the causes of miscarriages, number one, it can be infections. When you have infections and they are not being treated well, you can have a miscarriage. Number two, blood group incompatibility. What they call the rhesus factor incompatibility. Check your blood group. If you have negative and your husband is positive, or your husband is positive and for you are negative, the baby can get out. Number three, it can be as a result of chromosomal abnormalities. This one you cannot, you don't have control over it. It is genetic. And number three, sometimes some miscarriages happen when we don't even know what has caused them. Stress can cause miscarriages. Stress. So, all that can cause that. But what to do is to conceive again. And before you even conceive again, better to do tests.
All the tests were done. And
Which tests did you do? Which tests
all
did you do?
all the normal tests that I usually done.
What-
The infections.
Did you do blood group rhesus factor?
Yes, everything was done. I was told the miscarriage couldn't have happened because of those things. It didn't happen because of those things, because I was just okay.
Alright, so if it was normal, then it can fall into chromosomal abnormalities. Maybe it was genetic, maybe the egg had an abnormality, or the sperm had an abnormality. And when the egg or the sperm have abnormalities, you can have a miscarriage. But the most important thing is to have periods again and conceive again. Problems will be solved.
Alright, thank you so much.
Alright, thanks so much and have a nice time. Leave and for others to also ask questions. Email Love and Princess, first wait. Give me a minute. Let me first clear off questions on YouTube. I'll come back to you. But stay there and mute yourselves. I'll invite you later. Stay there. So we have Tanganyika Williams saying, hello doctor. I'm from Detroit. Detroit, where is Detroit? It is Namibia. America. Oh, you're in USA. Detroit, all right. I'm 45 years old. Period is normal in range. Had test done with dye at fertility. No health issues. Issue works on clomid. American, I'm not understanding the question. Hello doctor, I am 45 years old. Period is in normal range, okay. Had test done with a dye, that means you did an HSG X-ray with no health issues, okay. I'm on clomid, stopped going 6 months ago, finances took a turn. So what is your question? Tanga Williams from YouTube, what is your question? I don't know what you're asking, but what I've gotten is that you did HSG and it was normal and you're on clomiphene. Okay, that's what I'm getting. But the issue, if you're 45 years, you should not stop on doing an HSG. Go on and do an AMH, anti-mullane hormone with FSH and LH, but mainly anti-mullane hormone. Find out if your ovarian reserve is okay, if you still have eggs to enable you produce. Another one, Adesina, doctor, what's the cause of prolactin and progesterone, and how can it be cured? What is the cause of what? Now, which I don't understand your question, because everyone has prolactin, everyone has progesterone. So I don't understand what you exactly want to know. Rose, Adesina is a Man United fan. I see a logo of Man United. So ask your question very well. You see now you're a Man United fan and you're not asking questions very well. If you are an Arsenal fan, you would have asked this question better. Rose name is saying, good evening, I am from Ghana. Doctor, if someone periods keeps on changing, what could be the problem. Please, those on TikTok, first mute yourselves. I'm coming for you, and that noise causes a lot of issues here. Mute yourselves. I'm going to invite you. Don't worry. I will answer everyone who's doing that. So Rose's name is saying, "Good evening, doctor. I am from Ghana, doctor. If someone, your head is seen. If your head is seen on YouTube, Doctor, name Rose. Good evening. I am from Ghana. If someone period keeps on changing, what could the problem be? Periods keep on changing. It's a hormonal fluctuation. That is hormonal fluctuation. Hormonal fluctuations. Mutoni Angel, yes, doctor, I have PCOS. Mutoni, what can I do? I have PCOS. With PCOS, do fertility hormonal assay. Let's see your hormones. Then you can get medicines. Medicines include metformin, Primorius, and of course, after doing a fertility hormonal assay, you can get clomiphene or letrozole. All right, let me go to YouTube. I'll start with Emelove. Emelove, what are you saying? What is your problem? Emelove is not there. Let's have Princess. Princess, unmute yourself and ask your question. Princess, all right. Asia Namushanga is saying, I think we shall be having only 3 minutes. We shall be having only 3 minutes and we end this live. 3 minutes, we are ending our live. So at exactly 9 p.m. we are ending our live. So Asia Namushanga, if my period start on 10th and end on 15th, when will be my ovulation day? This one I cannot answer because I don't know the length of your menstrual cycle. First, let us know the length of your menstrual cycle. Who is live there? Ami Kakurut. Yes, tell us, how are you? Okay. Imilove, how are you? Where are you? And what's your problem?
Good evening, doctor.
Good evening to you. How are you? Where are you? And what's your problem?
I'm from Uganda, currently in Saudi Arabia.
You're in Saudi Arabia, huh? What's the problem?
I was asking that when I was in Uganda, when I'm going my period, I used to spend 4 days, and I was not having any signs of symptoms. But when I came in Saudi Arabia, if I'm going in my period, I have a sign of serious headache. Only one sign. Serious one.
Yes.
Even though I swallow Panadol, it can't.
So when
I go in,
you were in Uganda. The question. You were in Uganda. You never used to have pain during periods. When you went to Saudi Arabia, you started getting pain. Then when you're in Uganda, how many days were you having your periods?
4.
4 days, and now in Saudi Arabia?
1.5, actually 1.5.
Thank you. What is if you look at the weather, all the climate, now bring your geography here. The weather in Saudi Arabia and the weather in Uganda.
Here is too hot.
It is too hot on this side?
Yes, in Saudi Arabia it's too hot.
And then in Uganda?
Uganda is just a normal fire.
So change in environment. Environmental factors can affect hormones. Okay? Environmental factors can affect fertility hormones. But some people stabilize after like 2 years and above. Their bodies get stabilized and they cease to have those problems. But it is a problem of hormonal fluctuation as a result of change in environmental factors. You're going to ask for treatment. There is no treatment for that for now. What you can have is only getting painkillers. And also if you get heavy bleeding, you take NSAIDs.
What I'm asking, what caused that serious headache, that serious one?
It is hormonal changes, hormonal fluctuations. Hormonal fluctuations can lead to that. Like even some women, when they are going through their periods, they have some of them have pain, some of them have mood swings, some of them don't want to eat some things, some of them when they're in their periods, when they eat peanuts, they get swellings, they get a lot of reactions, and it is a hormonal issue. All right.
That is it, because for me,
All right. Nice time.
when I
Thank
was in
you.
Uganda, I had like I'm saying,
Yes.
when I was in Uganda, I had no any sign, even a single sign.
Yes, that happens, and I've told you it's because of hormonal fluctuations as a result of environmental changes. There is no problem. Don't take any medicines. You'll be fine. Just take painkillers always when the headache comes. Nice time and have a good night. We have.
Thank you.
This is all right. I'm reading only 2 questions on YouTube, and we close this. Princess, are you there? If you're there, get live. Let's talk. If you're not there, we close that chapter. So we now go to the last 2 questions. One is coming from Nabasumba Brenda, and another is coming from Mutoni Angelique. I'm not answering any question. It's time up. So Nabasumba Brenda is saying, "Hello doc, I am a cesarean. I'm a cesarean of 5 months. Now I lost my baby in the process due to preeclampsia, but now I'm trying to conceive, but Chigani. What could I do?" When was okay, 5 months, you did a cesarean. First give it some time. 5 months is little time. And also, by the way, if you do a cesarean section 5 months, you're supposed to conceive after 2 years. Members, please get to know this. When you do a cesarean section, you are not allowed to conceive again before 2 years. You have to give it 2 more years and then you conceive. So first give it 2 years. Muton Angelic, however, doctor, no one can have hormonal imbalance and have PCOS. It is possible. Very, 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 very possible. Very, very possible. End of questions on YouTube. Lastly, let me have Princess Chi. Please say your question and we go on. All right, she's not responding. Yes?
Hello, good evening, sir.
Good evening to you. How are you? Where are you calling from? You're the last person today.
Okay. I'm calling from Gabon.
Gabon. Yes, how is Gabon?
Fine, sir. Thank God.
So what's the problem?
Okay. Please, I want to ask, as in 27, 28, 30 cycle, when is that person going to?
All right, this is the last question. 27 days. I want one question. Time is up. Time bad.
No. This one is not that hard. It's 2 in 1 question. Then the second one is, what can somebody do to conceive twin baby boys?
I am going to answer one of your questions. It's time up. And I'm also going to combine it with this question on YouTube. Takolabi Barbara, hey doctor, my periods are not normal. They keep on changing. Time is 27, 28, 20 days. What is my fertile days? Yes, thank you. You said it is 27 days, okay? So I'm answering Takolabi, Barbara, and you. You're saying your cycle is 27 days.
Yes, 27 to 30.
Okay. 27 minus 18, what do you get? It is you to give me the answer. You and Takolabi. What's the answer? 27 minus 18.
14.
Yeah?
14.
Now, if you don't give me the right answer, you're dead.
27 minus 18.
You're gone. It is you to give me the answer. Whatever you give me is what I tell you.
You said 27 minus 18 now.
27 minus 18, what do you get?
It's 9. It's 9.
Okay, you get 9. Okay. Same applies to you, Takolabi Barbara. So 9 plus 4, what do you get? You're going to also work.
9 plus 2 is 11.
Is 11. And 11 plus 5, what do you get?
11 plus 5 will give you...
Takolabi, what do you get? Takolabi.
16.
Eh?
16.
You get?
16.
Are you sure?
16. Yes, 11 plus 5 is 16.
Are you sure? Because if you give me a wrong answer, you get wrong results.
11 plus 5 is 16.
Okay. 16.
Yes.
Thank you. So now, your fertile days, the days you can get pregnant, Mr. Kolabi Barbara, from the 9th day up to the 16th day, you can get pregnant. And you, princess, from the 9th up to the 16th day, when you see your periods like this today, that is day 1. 1, 2, 3, 4, 5, 6, 7, 8. Those days you cannot conceive. On the 9th day up to 16th, you can conceive. On 11th day, on 9 plus 4 is 11. You gave me 11. So you're going to get wrong answers.
Is there 9 plus 2 now?
9 plus 4.
9 plus 2?
It is 9 plus 4. You see how you're going to get wrong answers. Takorabi is also not helping you.
It's 13. It's 13. 9 plus 4 is 13. I thought you said 9 plus 2.
You see how you're going to get wrong answers. If you're not attentive, you'll end up having wrong answers. So it is 13. So this is your ovulation day. This is your ovulation day. 13th day will be your ovulation day. So if you want to conceive, sex on this day. Are we together?
Yes.
All right. Thank you so much.
Is it more that it will be that 13th?
Is it what?
Is it more that it will be that 13th day?
Yes, 13th day, that is your ovulation day. Keep that day in mind. That on the 13th day is your ovulation day, and that's when you'll be conceiving. We shall be having another live program next week on Thursday at exactly 17:30 hours East African time, or 5:30 East African time. Those who have missed, who have not had their questions answered, I will be answering them next week on Thursday. And those on TikTok, I'm told there are gifts there. Don't forget to send gifts there. You also keep tapping our screen. Share our lives always so that people can watch. And those on YouTube, it is easy to become a member of our channel. Check on go to Ask Dr. UTHUMAN. Become a member. When you become a member, you'll be having a lot of benefits, including one of them having a one-on-one chat with me on a live video, uninterrupted, when we are together. Thank you so much. We meet, and tomorrow at 8 p.m. 20 hours East African time, 8 p.m. East African time, we are going to release a video concerning how can you conceive when you have one fallopian tube. Is it possible? We are going to explain that today. Go to my YouTube and watch that video tomorrow. I sign out. Have a nice time. God bless you.
Okay. Hello.
Stupid.